And since we've never held a hearing quite like this before, we're coming at things with a fresh perspective. The committee is going to do its homework. We're going to hold hearings, roundtables, briefings, and site visits as COVID precautions permit. And we're going to think holistically, not just focus on one program or another, all to build a record that encourages not only Congress to act, but the administration too. Because we need, in my opinion, another White House conference on hunger. You know, the heads of food banks, hospitals, government agencies, educators, the faith-based community, people with lived experience, anybody who has anything to do with finding a solution need to be brought together in one room in the White House. And they should develop a plan to tackle this, something with benchmarks that better connects the dots between all the different federal programs. This is an all hands on deck moment, and it will take the full weight of the federal government. I also want to get the business community involved because the government alone cannot solve this problem. We have a lot of work to do to change the reality in this country. But if anyone doubts that it's possible, I want to end my remarks by quoting someone I mentioned at the beginning, and that is Senator Bob Dole, a Republican from Kansas. The ranking member and I recently received a letter from him, and I want to read it into the record right now. He writes, "Dear Jim and Tom, I'm writing to commend your joint efforts to address hunger in America. It sure brings back fond memories of working with George McGovern many years ago. Some thought we were an odd couple, but I still believe bipartisanship can work effectively. The 1969 White House Conference on Food, Nutrition, and Health was a call to action that led to the development of critical programs that continue to support millions of Americans 5 decades later. I remain proud of the work Senator McGovern and I did then, and I endorse your effort to secure a second White House conference to identify the next frontier of programs to finally end hunger in America. Our nation must keep making strides to end food insecurity in America. I appreciate your work to bring the topic of nutrition front and center in the United States Congress. Thanks for all you continue to do. God bless America, Bob Dole." I want to thank him for such a thoughtful letter, and I still think that we can do big things in the country. And to all the doubters, let me say this: there was a time when the sky was literally the limit. Then Americans dreamed bigger. We put a man on the moon. The same year of the first and only White House conference on hunger, by the way. We launched a cancer moonshot. NASA just recently flew a helicopter onto Mars, reaching a world away from a nation that is hunger-free. And before I turn it over to our ranking member, let me conclude with a story. In the mid-1960s, a documentary called Hunger in America ran on CBS. Like scores of other Americans, my old boss and mentor, Senator George McGovern, sat with his family and watched. Senator McGovern's first thought was, why are they looking at hunger in the United States? Many Americans believed hunger to be a problem of other countries, not ours. And as he watched, Senator McGovern saw a little boy tell the interviewer that he had no food at school and was regularly hungry. The interviewer asked the little boy how it made him feel to watch other kids eat while he went without. And the little boy said he was ashamed. That night, Senator McGovern told his family, it's not that little boy who should be ashamed. It's George McGovern, a United States Senator, a member of the Committee on Agriculture. More than 50 years later, we've made progress. Yet more than 40 million people are hungry in the United States today. So I'll say it. It's still not that little boy or the millions of people who face hunger today who should be ashamed. I am ashamed. We all should be ashamed. The time has come for the promise of this nation to be that no person goes hungry in America. No person, period. Not on my watch, never again. So that's what I'm working toward. That's what I hope this committee will work toward. That's why I'm calling for this White House conference, because patchworks and Band-Aids are not enough. They don't solve the problem. So before I turn to our ranking member, let me first wish him a happy birthday, because today is his birthday. And there is no better place to mark such a special day than right here in the Rules Committee. So with that, I yield to my ranking member, Congressman Cole.
Yes, Mr. Chairman, spending my day in the Rules Committee is a dream come true on my birthday. But I am genuinely pleased to be part of today's discussion on a critical topic that faces far too many in our country. And Mr. Chairman, let me add personally, we all know that your passion for this particular issue, but I want you to know we all respect your expertise as well. You've spent a lot of years working on these problems in the Agriculture Committee. You bring commitment that is born of many, many years' effort. And it's an unusual topic for our committee to deal with, but I'm glad you've chosen to take it up, and I look forward to working with you on this important topic. Despite the fact that our country is the most prosperous nation on the planet, far too many of our fellow citizens continue to face the heartbreaking challenge of hunger. My home state of Oklahoma, it's estimated that 1 in 5 children still do not get the nutrition they need to grow up happy and healthy. Moreover, Native Americans nationwide are literally 4 times as likely to report experiencing food insecurity compared to the rest of the U.S. population. The ongoing COVID-19 pandemic has made this problem even worse, particularly for those who are out of work or who cannot leave their homes. But while it's easy to identify the challenge, addressing the complex root causes of food insecurity and poverty remain elusive, even for members of Congress. The answer is clearly not just increasing funding to existing programs, though that may well be required, but modernizing programs to meet the current challenges that those in poverty face. We must view this problem holistically and approach our solutions the same way. According to research done by our colleagues at the Ways and Means Committee, low income individuals are eligible for more than 80 different programs, all of which are siloed to provide a specific benefit at a cost to the federal government of well over $1 trillion a year. I think the answer lies in a theory put forward in the 14th century by logician and theologian William of Ockham, quote, "The simplest solution is almost always the best," unquote. In addressing the issues of food insecurity and poverty, I think it's critical that we approach it with 3 goals in mind. One, supporting effective programs. With more than 80 programs on the federal level designed to address poverty, policymakers need to know which ones are effective and which ones should be redesigned to become more effective or even consolidated. Two, addressing the income cliff. During my terms on the House Budget Committee, we dove into this issue a lot. Unfortunately, the way many of our programs are structured, there's no way for people to transition off a public assistance program. They reach a certain income level and all of a sudden their benefits are gone. And so people make the rational choice. When given the option to work more hours, they choose not to because they become worse off as a whole. That's something clearly we should be working on and remedying. And three, working with the private sector. There's clearly a role for nonprofits and religious organizations in addressing the issue of poverty that must be encouraged by the federal government. Groups like the Regional Food Bank of Oklahoma, who provided more than 47 million meals in 2020 with almost 1,400 partner agencies, must be part of the equation. I want to thank our witnesses for appearing before the committee today. I look forward to hearing their testimony and perspectives. I look forward to continuing to examine this critical issue and potential solutions in the weeks and months to come. And particularly, Mr. Chairman, I look forward working with you on a problem that is genuinely bipartisan and where, as you pointed out in your opening remarks, we have worthy predecessors in Senators McGovern and Senator Dole who showed us that working together, we can make considerable progress. So I look forward to being your working partner in this endeavor. And with that, I yield back.
Well, thank you very much for your opening statement. I appreciate it very much. And I'm delighted to welcome an incredible panel that we have here today. And this is the first, this is our kickoff hearing. So we are really delighted that all of you have been able to join us. So let me read the witnesses and their backgrounds, and then we will hear from them directly. So Dr. Diane Schanzenbach is the director of the Institute for Policy Research at Northwestern University. She's an economist who studies policies aimed at improving the lives of children in poverty, including education, health, and income support policies. Her work traces the impact of major public policies such as SNAP, school finance reform, and early childhood education on children's long-term outcomes. Dr. Thea James is the Vice President of Mission and Associate Chief Medical Officer at Boston Medical Center. She is the Director of the BMC Violence Intervention Advocacy Program and Associate Professor of Emergency Medicine at Boston University School of Medicine. Dr. James has primary responsibility for coordinating and maximizing BMC's relationships and strategic alliances with local, state, and national organizations to foster innovative and effective models of care that are essential for patients and communities to thrive. Heather Reynolds is the Managing Director of the Wilson Sheehan Lab for Economic Opportunities. LEO, I guess that's, and an anti-poverty research lab at the University of Notre Dame. Ms. Reynolds is an expert speaker on poverty and nonprofit strategy. She has served as the CEO of Catholic Charities Fort Worth for 14 years before joining the Lab for Economic Opportunities team. Aisha Curry is a chef, two-time New York Times best-selling author, philanthropist, television host, and producer and entrepreneur. In 2019, Ms. Curry and her husband launched their family founded charity Eat, Learn, Play, with a mission to end childhood hunger, ensure universal access to quality education, and enable healthy and active lifestyles. She's also an ambassador for No Kid Hungry, an organization working to end childhood hunger. Again, I'm really thrilled that all of you accepted our invitation to be on this panel. Dr. Schanzebach, we will recognize you first. Welcome.
Thank you. Chairman McGovern, Ranking Member Cole, and members of the committee, thanks for the opportunity to appear before you at this hearing on ending hunger in America. So my name is Diane Schanzebach. I'm the director of the Institute for Policy Research at Northwestern, where I'm also a professor and economist who studies the role of SNAP and the economy on hunger, food security, health, and economic security. Let me start by briefly describing the current state of hunger in the United States. Now, even during a strong economy, there are several million Americans who experience hunger. In 2019, 35 million people were food insecure, which means that they didn't have the consistent and dependable access to enough food in order to live an active and healthy lifestyle. Now, 12 million of these food insecure individuals were also categorized as hungry. Hunger, or in USDA's terminology, experiencing very low food security, is a more severe measure than food insecurity. During COVID, hunger has swelled. Between August and March, on average, 36 million Americans, or 11% of the population, lived in households where they reported that they sometimes or often didn't have enough to eat in the past week. They were hungry. Rates of hunger have been especially high among households with children and among children themselves during COVID. Now, typically, measures of food hardship increase when the unemployment rate increases. So high rates are not surprising given what's happened to the economy. Some good news is that we've seen strong progress against hunger over the last 3 months. Rates of hunger peaked in December, with 46 million reporting that they sometimes or often didn't have enough to eat in the prior week. By the end of March, the numbers fell to 30 million, the lowest since the pandemic began. This recent progress reflects a range of factors, including the relief packages passed by Congress and also the strengthening job market. And I must emphasize that rates of hunger would have been even worse this past year were it not for government programs already in place, the emergency measures passed by Congress, and a surge of charitable giving and aid from food banks and other organizations. Now, the centerpiece for federal efforts to address hunger and food insecurity is SNAP. And it already does a lot to reduce hunger, but could be made even more effective with some modest policy changes. SNAP supplements the cash resources that a family has to purchase food, so that between SNAP and their other income, a family should be able to afford to buy a sufficient and healthy diet. SNAP's efficiently targeted to families who need benefits the most, and it's effective. It reduces the likelihood that families have trouble affording food. It also serves as an automatic fiscal stabilizer in times of economic downturns. SNAP also offers vital long-term benefits to children. Research that I conducted found that those who had access to SNAP benefits as children were more likely to graduate from high school and grew up to be healthier and more economically successful. SNAP serves a very diverse caseload. A large share has children at home, and the majority of these families are employed, but they don't make enough to afford the food they need on their own. For them, SNAP helps stretch their grocery budget and reduces the likelihood that they suffer hunger or food insecurity. Now, a lot of these families cycle on and off of SNAP, using it temporarily when their jobs or hours are unstable or when they experience temporary unemployment. Another large share of SNAP families have elderly or disabled members. They generally will be eligible for and participate in SNAP for longer periods of time because their incomes tend to be stable, but just too low to afford the food they need without additional help. The remaining 1 in 5 households in SNAP tend to be very poor, many with incomes below half the poverty threshold or even with no cash income at all. Many of these participants face substantial challenges and barriers that make finding stable employment very difficult for them. And in many of these cases, SNAP's the only assistance program available. SNAP can serve such a diverse caseload because it's well designed. The benefits are flexible, topping up purchasing power for those who lack enough money to buy the food they need on their own. It also provides a floor for food consumption for our nation's most vulnerable. A key reason for SNAP's success is that it relies on our very efficient private sector to provide access to food through grocery stores and other retail outlets. By increasing resources available to purchase food, SNAP does a lot. It increases food spending, it stimulates the economy, it lifts millions of people out of poverty, it reduces hunger and food insecurity, and improves both the quantity and the quality of foods purchased. When families receive SNAP, they're able to buy more nutritious foods that they otherwise could not afford. SNAP's effective, and it would be even more effective if the benefit were better aligned with families' needs. So even before COVID, there was wide recognition that SNAP benefits were inadequate to buy and prepare healthy foods. The benefit amount is based on an out-of-date foundation called the Thrifty Food Plan, but we can fix that. We also need to make sure that those in need can access SNAP benefits, and participation rates here are especially low among the elderly. And we can fix that too with a more streamlined application process for them. And we can talk about other policy and community solutions over the course of our conversation. Over the last year, we have seen the highest rates of hunger in the United States since we began systematically measuring it. And as we continue to emerge from the national crisis caused by COVID, we should not be satisfied with just reducing hunger back to its previous level. We can eliminate hunger in the United States entirely. And we can do this by better using the tools we've already developed. We can enhance SNAP, we can improve participation in other nutrition programs, we can make permanent these recent expansions to the Earned Income Tax Credit, the Child Tax Credit, and summer EBT. Each of these will also surely reduce hunger. Bolstered by stronger income and nutrition support programs, also the nonprofit sector will be made even more effective in filling the remaining gaps and addressing some of the root causes of hunger. Thank you, and I look forward to our conversation.
Thank you very, very much. Dr. James. You need to unmute. Here we go. Yeah.
Apologies for that. Thank you, Chairman McGovern, Ranking Member Cole, and distinguished members of the House Committee on Rules for holding this hearing and providing me with the opportunity to speak today about hunger in America and our bold intentions to collectively put an end to it. Again, my name is Dr. Thea James. I am Vice President of Mission and Associate Chief Medical Officer here at Boston Medical Center. This is also where I trained for my residency, and I've been honored to serve as an emergency physician here for the last 3 decades. Boston Medical Center is the largest safety net hospital in New England, and it ranks among the 10 busiest trauma and emergency services centers in the country. Our patients, the patients we serve, are predominantly low income, with approximately half of our patients covered by Medicaid or the Children's Health Insurance Program, or CHIP, the highest percentage of any acute care hospital in Massachusetts. Hunger, malnutrition, and food insecurity are all too common among our patients. In fact, of the more than 100,000 patients we've screened for health-related social needs to date, 1 in 5 identified as food insecure, double the national rate. The current pandemic and economic crisis has further exacerbated this need among our patients. In the emergency department at BMC, I see firsthand the ways in which hunger directly impacts health. Patients present for heart failure, diabetic emergencies, and these are things that could have been avoided with proper nutrition. I treat complications of conditions that are not adequately managed like seizure disorders and COPD because patients are having to choose between paying for food or paying for medicines. Treating illnesses in the emergency department that are the downstream effects of hunger is not only disheartening, it's the most expensive way to intervene. At BMC, we know we can do better by our patients if we move further upstream. And we are proud of our long history of addressing the root causes of what makes our patients sick, including the inability to afford enough food. And we know from clinical experience and decades of research that when our patients are hungry, their health suffers. And this is why BMC is committed to advancing solutions that reduce hunger among our patients and the communities in which they live. Our clinicians and staff are trained to look outside our four walls and move beyond healthcare to understand the social factors that impact our patients' health. At present, we have over 40 programs that address health-related social needs, and many of them have been replicated nationally. Over the past 40 years, our anti-hunger work has grown from a pediatric subspecialty clinic called the BMC Growth Clinic. This clinic treats babies that are diagnosed with failure to thrive. And it's an integrated hospital-wide program that's designed to meet the full array of our patients' food and nutrition needs. Emblematic of these efforts, our preventive food pantry, which has been in service since 2001, has grown to distribute over 1 million pounds of food annually to our patients and families facing food insecurity or specific nutritional challenges at home. Our patients are actually referred to the food pantry by a prescription from their clinicians in the same way that they would to receive medicine from the pharmacy. Our program began as the first hospital-based preventive food pantry in the country, and now our staff regularly advises other hospitals and health systems on how they can launch their own. People are often surprised to learn that our urban hospital campus also has a 7,000 square foot rooftop farm and a state-of-the-art teaching kitchen, which are integral to the BMC food and nutrition program. The rooftop farm, which is in its 5th year, plays host to more than 20 crops, providing fresh local produce to hospitalized patients, hospital cafeterias, the preventive food pantry, the teaching kitchen, and a weekly in-hospital farmers market. The teaching kitchen provides patients with opportunities to learn how to cook healthy meals specific to their clinically prescribed dietary needs, as well as how to utilize the foods that come from the preventive food pantry. In addition to these efforts, decades of research from Children's Health Watch, which is a research and policy network headquartered at BMC, has shown that enrollment in the USDA's SNAP program reduces food insecurity and improves health. Given these findings and other compelling evidence on the health promoting impact of SNAP, we recently launched an initiative to enroll likely eligible patients in SNAP through a robust outreach strategy and streamlined enrollment process for patients when they are applying for Medicaid. As an academic medical center and health system and an anchor institution for our local community, we are acutely aware of the power we hold to impact the health of our patients and community, given our role not just as a healthcare provider, but also as an employer, a purchaser of goods and services, and an investor. Given this role and commitment to moving farther upstream, BMC has made targeted investments in the community to address systemic causes of food insecurity and hunger among our patients. As a part of a multi-million-dollar investment in affordable housing and community-based programs, BMC provided a $1 million no-interest loan to establish a healthy food market alongside a new affordable housing development in the Roxbury neighborhood of Boston. Through this investment, we intend to disrupt the status quo by increasing the availability of healthy, affordable food options in the places where people live and people with low incomes live. While we work hard, really hard, to respond to the realities of hunger among our patients, we know that we cannot end hunger, even in our little corner of the world, on our own. We welcome the federal government to play a bigger role in ending hunger, not only as a convener and coordinator, but also as an incubator and accelerator, helping to ensure the scale of the solution matches the scale of the problem. I will close my remarks today by offering this anecdote. In a recent survey to patients at in our hospital preventive food pantry, we asked the question, What would it take for you to never need this food pantry again? As a physician, some of the responses to this question were heartbreaking. Many people we talked to said they could never imagine not needing to rely on the food pantry. To me, this highlights why, as a country, we must reimagine our commitment to ending hunger. In doing so, we must seek solutions that respond to its root causes instead of perpetually filling in the gaps that people have, and prioritize thriving for people in order to truly alter the quality of their life course trajectory. Holding this hearing today sends a signal that hunger is a solvable problem if only we can step outside of business as usual practices to chart a new course forward. Thank you for your time, and I look forward to the discussion.
Thank you very much. Appreciate it. Ms. Reynolds.
Chairman McGovern, Ranking Member Cole, and members of the committee, thank you for your time today. My name is Heather Reynolds, and I have the privilege of serving as Managing Director of the Wilson Sheehan Lab for Economic Opportunities, or LEO. LEO is a research lab at the University of Notre Dame that helps service providers apply scientific evaluation methods to better understand and share effective poverty interventions. Prior to coming to Notre Dame, I spent almost 2 decades at Catholic Charities in Fort Worth, the last 13 as CEO. My time at LEO and at Catholic Charities have both shaped my insights on the audacious goal of ending hunger in our country. A wise man once said, "We have the food, the ability, and the means to end hunger in America. What we lack is the political will and moral courage to act. We must change that." Thank you, Chairman McGovern, for this source of inspiration. I have 3 points on how we can achieve your vision. First, ending hunger begins with the safety net, but it does not stop there. The safety net plays a key role in combating hunger. The SNAP program ensures people, most notably children, are not hungry today. While SNAP provides a modest benefit, an average of $1.39 per person per meal, it is part of a critical foundation for the well-being for vulnerable Americans. The social safety net lessens the impact of poverty on families in difficult situations, treating the symptoms of poverty and not their root causes. The causes of poverty vary considerably across people: lack of skill, a mental illness, the absence of a parent in the household, a physical disability. Unfortunately, the social safety net cannot alter these underlying conditions. Rather, it can only help provide what poverty is preventing: health insurance, 3 hot meals a day, a roof over a family's head. A coordinated effort to eradicate hunger must then include programs whose larger goals are to move families permanently out of poverty. These programs work hand in hand with the safety net and can only be successful when the safety net is effective. Service providers and local governments are implementing innovative programs aimed at generating upward mobility. These programs, with economic stability as their goal, work in the context of the broader safety net programs. At LEO, we are running several studies, one in Texas, Indiana, and South Dakota, all aimed at getting students with low incomes credentialed and degreed to support a goal of increased earnings. Our evidence shows really promising results, but it also shows that providers must balance the short-term needs of clients with the long-term need of financial stability. People cannot work on their education if they worry that their child will not have food on the table tonight. The safety net is needed in our country, but its role is to ensure people are not hungry today. Tomorrow's hunger needs to be solved differently. Which brings me to my second point. To achieve an end to hunger, we need comprehensive, family-centered solutions to poverty. We need a comprehensive approach that provides not just food, not just housing, not just job training, but also the human support and interactions that drive changes and choices in the face of despair. These solutions need to be family-centered, individualized, and comprehensive. Simple declarations such as getting people employed, they just fall short. We need to look no further than the SNAP program to see this. As of 2018, 79% of all families receiving SNAP had at least one person working. I found this to be true from my experience as a service provider. We served over 100,000 people a year. More than 70% of our clients had full-time jobs, yet they were still walking through our doors needing assistance. The Padua program, operated by Catholic Charities Fort Worth and studied by us at Leo, is designed to see all this complexity that poverty brings and address each element through supportive case management. This holistic approach begins with assessment and a case plan, engagement in the safety net as a first step, small caseloads for staff, case managers serving as both connectors and coaches, and the ability to serve clients for the long haul. Padua is designed to support participants to reduce dependency on benefits, earn a living wage, accumulate savings, and reduce bad debt. Our study at Leo showed that participants saw a 25% increase in full-time employment. But Padua was particularly successful for those who were not already employed at the time of enrollment, with 67% increase in the probability of working full-time and a 46% increase in monthly earnings. Health conditions improved by 53%. Participants who lacked stable housing when they entered the program saw a 64% increase in housing stability. This program demonstrates that weaving the social safety net with holistic programming for those who need it can have the greatest impact. To achieve an end to hunger, a more comprehensive solution to poverty, like Padua, is needed. So why do I believe in solutions like this are what our country needs? Because not only do I see the clients, know their stories, and believe in this approach, but I have evidence to back this up. Which brings me to my final point. Ending hunger will not happen through hunches, assumptions, and good intentions. Ending hunger will happen with evidence-based programs and policies. Leo evaluated the Excel Center program in Indianapolis. This program works with adults to help them complete their high school degree. It does so with holistic support by accommodating students' work schedules, providing childcare, and helping them navigate the challenges that come along with completion. Our research showed that going to the Excel Center leads to significantly higher earnings and a move from the service sector to health and education sector jobs. Graduates have higher earnings than adults who instead complete the more typical GED program. Programs like this work with low-income individuals to improve their financial outcomes, support a move toward economic stability, and thus achieve food security. The social service community contains the innovations that, when studied, can show us what works. At Leo, we spend our time engaging with those poverty fighters on the front line and bring to the table the research rigor to shine a light on the impact of their services. We do this because we believe people in poverty deserve interventions that work. We conduct causal evidence building, typically through randomized controlled trials, with providers across the country to learn what works and then to ensure that evidence is used. We have witnessed our partners discover something they're doing doesn't work, and then they pivot and change their model for the good of those they serve. We have also seen our partners learn that something does work, and they scale it up so they can serve more people in their local communities or break into new markets with this proven intervention. We need you as policymakers to see this as well. The gap between policymakers, academics, and social service providers is wide. We need local, innovative solutions implemented by dedicated service providers, paired with academics to help discover evidence of what works, and then scaled up by your investment in them as policymakers. In closing, ending hunger begins with the safety net, but it does not stop there. We need comprehensive solutions for families to live a life outside of poverty. Evidence-based programs and policies will ensure we are offering families services that work. Chairman McGovern, I love your quote and I share your belief. I would just suggest one little addition. We have the food, the ability, and the means to end hunger in America. What we lack is the political will, the evidence-based programs and policies, and the moral courage to act on them. And I am with you, Chairman. We must change that.
Thank you very much. Ms. Curry, welcome.
Hello. Chairman McGovern, Ranking Member Cole, and members of the committee, thank you so much for the opportunity to appear before you today to testify to the importance of ensuring that every child has the nutritious food they need to thrive every day. My name is Aisha Curry, and I am the co-founder of Eat, Learn, Play Foundation and an ambassador for the No Kid Hungry campaign. Millions of children, as we know in the United States, live with hunger right now, including many in the community of Oakland, California. I've seen firsthand the impact hunger and hardships have on kids and families. Through my foundation, Eat, Learn, Play, and our partnership with No Kid Hungry, I have seen how national and local programs can work together to reach as many of those kids as they can. But it's truly not enough. We need Congress to strengthen the programs that keep food on the table for kids. This hunger crisis in America is extremely urgent. More than 13 million kids are living with hunger in our country, and this hunger affects everything from their ability to learn, their physical and mental health, the opportunity to reach their full potential, and so on and so forth. It's completely cyclical. And every missed meal counts for a kid because an empty stomach that hurts today also hurts their futures. This is especially true for kids from families of color who face hunger, poverty, and hardship at even higher levels. I've personally seen hunger in the community of Oakland, but I know that no community, urban, suburban, rural, is free from this issue. Food is not an essential school supply, it's the essential school supply. And when kids don't get the food they need, it's harder for them to learn or focus in class, affecting everything from test scores to graduation rates. There are numerous studies that back this up and show proof and evidence of that. I'm a working mom, and my husband and I have 3 little ones at home. And as a mom, I know what it's like to want to build a strong, healthy, and successful life for my children. I know how important a good breakfast is for all of them to help them focus and learn, and how I'm sure, as many of us know, with the Zoom school and the pandemic, how cranky they can get when they're hungry. Things just don't work the way that they should. Families are already working so hard to make ends meet, but no mom or dad should ever have to deal with the pain and stress of wondering how they're going to put enough food on the table for their kids tonight. So that's why I'm also an advocate. The work of Eat, Learn, Play is rooted in being a village for those who don't always have one. And the effects of COVID-19 created an unprecedented challenge in our community. So I want to take the time to just share a story of a loving mother who, like many, faced incredible hardships this past year. Christina is a Black woman from the San Antonio neighborhood in Oakland, California. She's a single mom of 2 children who attended an elementary school there called Garfield Elementary School. It's a part of the Oakland Unified School District. And Christina's children are among the 18,000 students that have counted on their schools for a significant percentage of their nutritional needs. March 13th last year, OUSD's school building shut down because of the pandemic, and parents like Christina were left wondering where their child's next meal would come from. Shortly after that, Christina was laid off from her service industry job because her business closed when local shelter-in-place orders went into effect. I know you guys are hearing this story and saying this is nothing new, and that is devastating to me because Christina's story is very similar to the 10,000 Oakland families who showed up twice a week to receive meals during the pandemic at OUSD meal distribution sites and throughout the nation at distribution sites just like it. This is thanks to critical federal nutrition programs and the heroic work of OUSD school workers. Oakland students have continued to have access to healthy and nutritious meals. This past year has shown us how critical nutritious meals are in order to keep children healthy and on track to reach their full potential. Like McGovern said, childhood hunger is completely solvable. And federal nutrition programs are essential for kids to get the food they need, no matter where they live or what time of year it is. But to reach as many kids as we need to reach right now, we need these programs to be stronger. And that means action from Congress. For example, like we've heard today, programs like SNAP and WIC are grocery benefits that make sure parents can feed their kids at home. Increasing these benefits means families can purchase more of the groceries their kids need when they need them. School meals make sure kids have the nutrition they need to focus and stay nourished during the school day. And finally, summer. Summer is actually the hardest time to reach kids with the food that they need. But last year, we actually saw what happens when schools and organizations were allowed to modernize their programs, letting parents pick up multiple meals at a time or dropping meals off directly to a child's house. I do want to take the time today to applaud Congress and the White House for expanding the pandemic EBT program through this summer when kids and families struggle the most, and building on PEBT by proposing to make summer EBT permanent. We will need continued help from Congress to make sure programs help hungry kids during the summer, the hungriest time of year. So I'm very excited for this and hope that we can solidify it. I've seen our foundation be a part of the hard work happening on the ground with hunger heroes in our community who are doing amazing work to feed kids every single day. Like I said earlier, it truly takes a village to meet the level of food insecurity caused by the pandemic. Our collaborations with organizations like No Kid Hungry, World Central Kitchen, the Alameda County Community Food Bank, OUSD, and so many other wonderful organizations has made an incredible impact for hungry kids and families. But charities alone cannot fill the gaps to make plates full and children whole. So today I'm really coming from a place as a mom, an advocate for change. I came to the United States when I started high school, and I thought that, it was going to be like an episode of Friday Night Lights, and that turned out not to be true. The person sitting next to me, would come to school without a meal. Who knows that the person sitting down the table when they had their last meal. And just to know now as a mom that my children can be going to school with children who have not eaten or don't show up to school with a lunch or don't have food during the summer is just baffling to me. And as Chairman McGovern said earlier, this is completely solvable and the money is there. So I really feel like we need to get together and solve this thing because it's completely solvable, and we really need to change this. So what I'm trying to say is, Congress, kids need your help. You have the power to change this. And with your leadership, these programs can be stronger, more flexible, and reach more kids. People used to say hunger is a nonpartisan issue, and I really want to stand here today or sit here today in front of you and say that we all need to be kid partisan without question. So I urge Congress to support and strengthen federal nutrition policies to close the summer meal gap, strengthen school meal programs, and ensure benefits like SNAP and WIC are reaching the kids and families who need them. And finally, I would like to invite all of you to come out and see our work here in Oakland, to meet the people behind these stories, to learn their triumphs and struggles firsthand and see the difference that these federal nutrition programs make in their lives. In closing, thank you guys so much for allowing me to meet with you today and speak my piece. And I am so grateful for our time together. So thank you.
Thank you very much, Ms. Curry. Thank you to the entire panel. Ms. Curry, I would, if the COVID restrictions get lifted and we can travel, we'd love to visit Oakland. And I appreciate you telling us the story of Christina, because sometimes when we talk about this issue, we get inundated with statistics and and graphs and trend lines, and we forget. Sometimes we lose our human ability to feel. I talked to a group of people who are struggling with hunger and food insecurity, just in preparation for this hearing the other day. And again, everybody's story is unique and different and complicated. And I think if we're going to move forward, we need to hear from those with lived experiences, because they're the ones on the front lines who are struggling. And one of the reasons why I personally believe there ought to be a White House conference is because I think we need to, as everybody here has said, that we need to address this issue more broadly and more holistically. The way Congress operates, we talk about SNAP when the Farm Bill comes up, and that's under the Agriculture Committee. And then if we're talking about school feeding programs, we wait till the Child Nutrition Reauthorization Bill comes up, and that's under Ed and Labor. And then Ways and Means does the child tax credit, and so we talk about little bits and pieces, but not the whole picture. There's no one committee that deals with hunger here. And there's no one committee that deals with nutrition here in Congress. There's no one agency in the executive branch that deals with hunger or deals with nutrition. I mean, it falls under USDA, it falls under HHS, to the extent that housing is relevant to this discussion, it falls under, the Department of Housing and Urban Development. I had a conversation yesterday with the new Secretary of Transportation, Secretary Buttigieg. Many of us on the Rules Committee had a conversation with him. And there's a piece of this that falls under Department of Transportation. I mean, people need to get to and from places. In addition to, infrastructure, refrigerated trucks, and how do we rebuild our schools so that every school has a kitchen, things like that. And I began by referencing George McGovern and Bob Dole. Well, back then, I think they understood that they created a special select committee on hunger and nutrition because they knew this issue fell under so many different jurisdictions, and nobody was waking up every day and saying, how do we solve this? So look, I think, a White House conference is what we ought to aim for. And what we're trying to do is build a record, do all the, groundwork, if you will, so that if we can get the Biden administration to agree to this, that it's not just a press conference, that it is real and substantial. We had a White House conference 52 years ago. I look back on that. It produced a lot of good things, but there were lots of things that were missing in that conference. People with lived experiences were not part of that conference. It wasn't as inclusive as it should have been given the population in this country. So what we want to do is figure out ways, to build on the best of what happened 52 years ago, but make it even better. So let me just say, again, thank you all for your testimony. Let me just start where I think we all agree. So each of our witnesses, and tell me if I have anything wrong here, everyone here agrees that hunger is a solvable issue, that there's no one silver bullet to solving hunger, and that we need, government, nonprofits, the private sector, and others, that we need them all working together. Our medical institutions, we need to be all working together in order to solve it. Are we all in agreement on that? Just everybody's yes, yeah, all right. Nobody disagree. Okay, we all agree on that. All right, so each of you has discussed how economic opportunity plays a significant role in the hunger problem. We all agree that there is dignity in work, but for too long, work doesn't work for most workers. And what I mean is that people work sometimes 2 or 3 jobs, and they still can't get the financial security that the middle class promises, that the American dream remains out of reach for many of them. This presents families with a series of impossible choices, whether it's deciding between housing and food, or healthcare and food, or education and food, or work and food. The cost to the lives of people experiencing hunger is profound. So to each of the witnesses, when you think about what it will take to solve hunger, to what extent should Congress be thinking about economic opportunity? And we could begin. Yeah, Dr. James.
May I take a crack at that?
Sure. Go ahead. Yes.
So, one of the things that I've had the privilege to learn over the last 3 decades of being an emergency physician at the largest safety net hospital in New England is to ask patients all the time what it would take for this not to happen again, this repeat visit, this repeat hospital admission, this sort of cycle of perpetual instability. And the one thing that I have learned is that, and Ms. Reynolds asked the question, she was talking about safety nets. We've had the opportunity after all these years of asking ourselves, not that long ago, what is the role of a safety net? And in our case, a safety net hospital. Is it in fact charity exclusively into perpetuity, or is it equity? And I would say the difference between the two is, we've had as I mentioned in my remarks, over 40 programs in our hospital. But what has been the role of the hospitals? What of those programs? What they mainly do is fill the gaps that people have. We're preventing people from falling down. We're preventing people from, falling off the cliff. The intentionality of those programs has not necessarily been to eliminate the gaps, because I believe that only through eliminating those gaps is it possible for people to become self-sufficient, have financial security, economic mobility, and even opportunities to build wealth. So I think a lot of it is, what is the intentionality of our resources and our subsidies? And when I think about, for example, let's just take public housing, for example. And I think subsidies are fine, but I think they are designed to fill a gap for people. I think we could do better if we designed them for people to become self-sufficient and have financial security versus penalize them for trying to do so. You're limited as to how much income you can earn living in public housing without losing the housing. And I'm not suggesting that people should have these low cost housing units into perpetuity, but I don't believe that at all. But I think that they should be designed to enable them to be like the rest of us and able to, move forward in life, move up in life, to change socioeconomic status, change socioeconomic lanes to get out of the line of need, so that ultimately, by having financial security and economic mobility, you're actually able to contribute to the GDP, for example, or contribute to the economy versus relying on it. Because when we don't take that opportunity to be able to provide that sort of pathway and life-altering trajectory for people, we wind up having to subsidize to take care of them anyway. And so on some level, I mean, I think monetarily, we all could, it's a win-win situation all the way around. So, and the last example I'll use is during the height of COVID, when we had the $600 unemployment, payment for people. But the exchange for that was to remove SNAP. And so I think that doesn't really help anyone. I think if all of us imagine ourselves, if we had $600, it's not like now we have enough to thrive. It's basically just people surviving. So I think the main thing is intentionality, to move from filling gaps to eliminating them and aiming for financial security and economic mobility and opportunities for people to build wealth. And to not choose pathways or make decisions for others that we would not make for ourselves or our families, because we all want the exact same thing, which is thriving and being able to contribute to the betterment of our country and our economy.
Thank you
And
very
I'll
much.
just add on to what Dr.
And
James.
Ms. Reynolds, okay. I'll get to everybody, but Ms. Reynolds, go ahead.
Great. I'll just add on to what Dr. James said. To address hunger, I feel like we as a country have got to address poverty, because the realities is that, people walking through the doors, trying to receive safety net programs, walking through the doors of social service agencies, they're coming there for today's needs. But I can't tell you how many times when I was at Catholic Charities Fort Worth and would work intake, the humiliation that often was present with the ask and the outreach for whatever was needed. And people want a life outside of poverty. People deserve a life outside of poverty. And so I think if we could solve this in a comprehensive way, where we're not just looking at solving hunger, but solving upward mobility and creating economic opportunities for Americans, I think it will go a whole lot further. Might be a little more pricey at first, but I think will save our country so much in the long run by what it will achieve for our nation.
Thank you. Dr. Schanzenbach.
Yeah, of course, broad-based economic growth is going to be our best friend in terms of eliminating hunger. But I want to sort of remind everyone that it's, a large fraction of people on SNAP are working, and they're working a lot, and they're in, what we think of as, good jobs. They're health aides, they're cashiers, they're cooks, but we haven't seen wage growth in that aspect of the economy in a very long time. And so I think, of course, it's appropriate for SNAP to come alongside and make sure that they have enough to eat. But without question, as the economy grows, as we see the wages improve, see more people become employed, the cost of these programs will go down because people won't need them anymore. But it's just the economy, you've got to start there.
Thank you. Ms. Curry.
Yeah, for me, I think if we could find any silver lining in the pandemic, it's with our nonprofit, we were able to build out this program that, in my opinion, does show economic growth and the cyclical nature of what happens when we do solve hunger. And for us, I feel like with solving hunger, we've also been able to solve other issues when it comes to restaurants and farming, which are so important. And so for us, we built out this infrastructure where, we were able to have restaurants get back into business because they were providing the food for the community, and the farmers were providing the produce for the restaurants. And so it was this big cyclical nature and effort that I think has really worked. And I think it's just going to require a big, giant meeting of the minds with Congress and the White House to really figure out how to build out a plan for everybody in their small communities. And I think that sometimes we're thinking so big picture that we forget to think small like this and have people start in their own communities and build out a program that way. And I think that if you were to use something as a model, I think what we've built in partnership with World Central Kitchen has actually been working out here. So it'd be interesting for you all to take a look at it and see how it's worked, because I feel like it's something we could implement many places across the nation. So.
And I think, that's, I think that's a good point. I mean, I've seen lots of initiatives throughout my travels that are really quite extraordinary. I mean, Dr. James, I've been to Boston Medical Center many times. I've seen your food pantry and I've seen your growth clinic, and it's like, I really love it. And I say, why doesn't every hospital do this, right? And you see these and lots of different initiatives in different areas that one wonders whether they could be expanded, but obviously it takes some seed money to help others to be able to follow suit. Some of it can be replicated, some of it can't. But one of the things we hope to look at is like, what is right now working, whether on a large scale or small scale, and if it's on a small scale, how can we replicate it? I appreciate too the fact that everybody, all the witnesses, are reminding us that a lot of the people who are hungry in this country work. I sit on the Agriculture Committee, and a great source of frustration for me has been that during debates on the Farm Bill, when we talk about SNAP, I'm not sure that fact is appreciated, because people usually say, have people go and get a job. Well, the bottom line is, the majority of those who are able-bodied who can work are working, and they still earn so little they qualify for SNAP. So these people are doing everything they can, to try to, get ahead, but they can't. And then you add to the equation the cost of housing, and then you add, the cost of healthcare, and then you add, transportation costs to and from. I mean, it becomes overwhelming. All right. So, it's not as simple as, people who are on SNAP just need to go out and get a job. The majority of people on SNAP, by the way, are children, right? But of those able-bodied adults, people work. And I think so much of our discussion has been very punitive. I mean, it's been, we want to put another, if you're an able-bodied adult without a dependent, you can only be on SNAP for 3 months. And if you're not in a work training program and don't have a job, then you're off for 3 years. Like, as if somehow if you're hungry, you're going to be more employable or you're going to be able to find a job easier. It just, so I appreciate the fact that everybody here has made the point that, this doesn't fall into these, you've helped correct, I think, what is a false narrative. I should also point out for the record, when people say, oh, you guys just want to expand government programs. Well, there may be a need for expansion, or there may be a need for consolidation, or thinking out of the box, reimagining, how we do this. I mean, that's, those are perfectly legitimate areas of discussion. But, if people are really concerned about the bottom line and the dollars and cents, I mean, there is a cost to hunger, right? There is a cost to the status quo. Ms. Curry talked about children, and I mean, children who are hungry cannot learn. I mean, that school meal is every bit as vital to that child's ability to learn as a textbook or a laptop. I mean, if you're hungry, you can't focus. If you're a worker who's hungry, you're not productive in the workforce. I mean, and there was a 2014 study that found that food insecurity costs an estimated $178 billion with a B, dollars that year in direct healthcare costs, lost work time, and additional education expenditures. And Dr. James mentioned in Massachusetts, it was a Children's Health Watch. They did a study that said in Massachusetts, hunger costs at least $2.4 billion a year in health-related expenditures alone due to poor health, pulmonary disease, diabetes, mental health, obesity, and more. This is a healthcare issue too. And yet a big chunk of our healthcare industry does not treat this issue, Dr. James, as Boston Medical Center does, for example. How do we change that? How do we get, I mean, I learned that if I want to become a doctor, then I go through medical school not to have to take any courses in nutrition. I mean, food is medicine. I mean, it's like how, I learn how to prescribe a pill, but I don't learn how to tell you to live a healthier lifestyle so that, you don't have to be on all these pills. You don't get these chronic diseases. But anyway, I've got some more questions, but I want to yield to my ranking member, Mr. Cole, at this point, and then I'll get back to you. But thank you again for your wonderful opening statements.
Thank you very much, Mr. Chairman. I agree with you. Very good opening statements, very robust discussion. I just posit, I don't think there's much doubt that a rapidly growing economy is kind of a precondition. It's not an end all and be all, but it helps when you had, as we did pre-COVID, the lowest unemployment rate in 50 years, the fastest economic or the highest consumer confidence in a generation. And we saw literally fast wage growth at the lower end of the spectrum. So that's something we need. And it's the first, but not the only way of dealing with. But even when that was happening, we still had hunger in the United States. We still had problems that the country faced. And we were still spending considerable amount of resources on all this. And I'm not arguing that we shouldn't do that. But I'm not sure we're very good at program design when it comes to dispensing those resources and getting them where people need. So a lot of people on this panel have really extraordinary experience in program design. Ms. Reynolds, let me start, if I may, with you, because you studied this in a whole variety of contexts, from the nonprofit side through the academic research, variety of states, different people in different circumstances. We've got, again, an enormous number of programs, and I'm not saying we only need one program. There are different aspects of poverty that you need to treat, and I think that takes care of a lot of the problem with food insecurity. If people aren't poor, they're able to go get what they need. So if you had to look at our federal programs in particular and pick out some principles that you would say, okay, if I'm designing a program that's going to effectively, number one, get somebody out of poverty and put them in a position to be food secure, what are the sorts of principles I would, focus on? What are the things I would do, or what would be the lessons I've learned that I would try to avoid, or try to learn from, try to avoid mistakes we've made in the past?
Well, great question. Thank you for presenting that to me. Just to kind of start off, there's two things that come to mind. I think first is, and we kind of hit on it earlier, we need to understand what our goal is in each of these federal programs. And then from there, understand, did we achieve the intended goal? So let me give you just a very simple example. All across the nation, there are these call centers. In communities, they're called 211 or 311 lines. People in need in communities can call those to find out, where they can get utility assistance or rent assistance if they're about to be evicted. So they're for people who have had a big crisis. And all across the United States, we offer these. Yet it was really interesting to us because as we at Leo kind of started looking into some of these call centers, what we learned is the goal of the call centers were to prevent homelessness, yet really how the call center was tracked as being productive and hitting their goals was the numbers of calls they answered. And so it was really exciting to us because one of these call centers in the city of Chicago actually is run by Catholic Charities in Chicago there. And so they asked us to come in and to do a study so we could understand, did the call center who was answering calls, who were giving out assistance to people who were about to be homeless, did the call center, did the support work? And so what we were able to do through a quasi-experimental design at Leo is we were able to evaluate this program, and we were able to show that those who received the funds saw an 88% decline in being homeless after 3 months and a 76% decline after 6 months. And so what this meant was the goal of the call center is to prevent homelessness, and it actually works. The research shows that it works. And so that would be an example of if the goal is to prevent homelessness, investing in emergency financial assistance programs across our nation are a really great thing to do. But then again, if the goal is something different, such as community college completion. An example of that is a project we ran called Stay the Course at Leo. And this was comprehensive case management to get people to complete community college so they could increase their earnings for the long haul. The goal of this program was completion. And so the intervention that was needed here was entirely different. We didn't need emergency financial assistance. That may have been a little part of the intervention, but what was needed was comprehensive navigation and support is what the evidence showed in order to drive the intended outcome that we wanted to have, which was completion. And so, Ranking Member Cole, the way I would just explain it is in each of these programs, we have to know what is our intended impact, and then we have to build evidence to know, does this specific intervention achieve the intended impact of that program?
Well, you're clearly doing that from a, again, nonprofit standpoint. Do you, in your experience, which is considerable, you see us doing that in government very much? In other words, going back, and we all talk about this as members of Congress in our respective committees, we try and legislate, but I don't think we very often go back to see if the legislation we passed actually works or the program we created. We just don't get a lot of feedback, I think, sometimes. We just get caught up in what the next thing is. Do you see some efforts in the federal government or something you could point us to that we would like build in? And we all know we have a government accounting agency. We use them from time to time.
Yep.
I think they do very good work for us, but I don't know that we systematically evaluate all these different programs to decide, hey, this one's really working great. We should probably invest more money in it.
Well,
This one, maybe not. Maybe that money should be diverted over here.
Yep.
Do you see much of that?
I think that's what you have economists like we have at Notre Dame or Northwestern or other places across our country who want to do this work and answer those questions for you. An example that I could point to is the Housing First model. This all started through some experimentation that was going on in New York City, where we in New York, folks were saying, oh my goodness, like 10% of the homeless in New York were taking up about 90%-ish of the resources. And so what kind of came from that is some studying to understand more, some RCTs that were run. And then ultimately, under President George W. Bush, the Housing First Initiative was born and funded in a big way across our nation. And then it was expanded under President Obama to include HUD-VASH for veterans and other things. And so that is an example to me of leveraging, the federal government leveraging provider knowledge, which a lot of these ideas came from local innovations, paired with economists and other academics overlaying their expertise into things to show what works, and as well as to continue to study it. So that would be an example I would point to say a time where we as a country and all of us have done a really good job of pushing forward a policy that makes sense and works.
Yeah, Dr. Sansenbeck, let me go to you and talk a little bit and get your perspective on, sort of income cliffs, if you will, which I think we create a lot of in the federal government. And then we get mad at people because they're perfectly rational and decide they're not going to engage in some sort of behavior that we think is desirable that then costs them benefits, but their living standard goes down even if their income went up. Because we've been very inartful about designing an exit from a particular program to self-sufficiency, which is, I think, where we want to get as many people as we can. So can you give us some thoughts on what we can and should do? I think, we're having this problem right now. I'm sure some of my colleagues have the same problem. I can go through my district right now, and some of my employers will literally tell me, I can't get people to work here right now because the unemployment benefit is higher than I've historically paid them. And they're making the perfectly rational decision. I think I'll stay where I'm making more money as opposed to go back to work. And when I have to go back to work, I will. And we can argue a lot as to whether or not that's wages, although again, that's a big problem. I think you mentioned the $600, I know one of you did, $600 additional unemployment benefit we have. Believe me, that's one thing in New York City. It's quite another in Wewoka, Oklahoma. I mean, the one size fits all geographically creates a real problem for you. So I know some of my colleagues might not even experience this problem because the dollars don't go as far in their respective areas and economies as it might in a relatively small town in rural Oklahoma. So anyway, any thoughts or guidance you can give us on this so we could be more constructive, really help people get to self-sufficiency instead of saying, we've got you to this edge, we're kicking you off, or we're mad that you won't jump off, even though you're going to end up with less benefits for you and your children.
Yes, so many great questions there. Let me start by sort of addressing your broad question about what's well designed and what is less well designed. And I want to say that the two big workhorses for anti-poverty, especially for families with children, are the Earned Income Tax Credit and the Supplemental Nutrition Assistance Program, SNAP. When I teach my undergrads, we always start by reading Milton Friedman and him thinking about what's our optimal way of designing a program. And he had a couple of things that he said. One of them was people should always be better off if they're working. So, when we have to take away the resources, which we do, we have to phase them out, but do it slowly over time. And so then we pivot and look to see how is SNAP designed, how's the Earned Income Tax designed, and they're really very much in line with exactly what Milton Friedman suggested, way back, 50 plus years ago. And there's a couple aspects of that. First, that the Earned Income Tax Credit actually gives people more than $1 back for every dollar that they earn for a certain part of it. And we have tons of research on this, as Heather said, mostly done by economists, in academic outlets. And we know that the Earned Income Tax Credit induces people to work, and then there's all sorts of other positive benefits that come from that. Similarly, with supplemental nutrition with SNAP, we don't really see the big benefits cliffs with that because we've designed it. Now, I will warn you that in recent months, even this was part of Senator Romney's child tax credit. They want to, make some changes to some of these programs that I think unintentionally would make those cliffs worse. And I agree with you. We want to sort of phase things out. We want a soft landing so that if you work an additional hour, you earn more. And there are some places, but not, where that doesn't happen, but not in sort of the big workhorses here. And so for sure we can, we can work on fixing some of the incentives around other smaller programs. But I will tell you that, the Earned Income Tax Credit and SNAP are well designed, and I'm really excited about the potential for the new Child Tax Credit to, to help along that as well. And the way they've designed that, it persists for a long period, and so families aren't going to get the rug yanked up from under them when they start working.
Good, thank you. Dr. James, we talked and the chairman touched a little bit on this in his exchange with you about the food pantry that you have at Boston Medical, and how common is that? And coupled with that, I assume there's an immediate needs problem, obviously, but also long-term nutritional advice that families really need as to what thinking about how you put together literally a menu for your family over a week, so that they're not only getting fed and they're not hungry, but they're actually getting the nutritional needs that they need as well.
So, Mr. Cole, you're asking how common
Yeah.
does this happen? Well, I mean, pretty often, every single day. I mean, we feed about 7,000
Oh,
families.
no, excuse me. I meant how common in terms of you see other institutions like your own doing this. In other words, are you a shining example out there by yourself, or have other people begun to emulate you?
Well, I mean, we were the first, prescription-based food pantry, connected to a hospital in the country. I do believe that, more people are focusing, but I don't think that it's extremely common, because we are advising others who've asked us about how we did this and how to do this. So it's not that common, but these are the kind of things that we've used to operationalize innovation, to try to create a transformative pathway versus to stay where we are. Because what generally happens is when this translates to unstable disease, we're really treating people and resetting them back to baseline, but then just discharging them back to exactly what's driving it. And I would say the previous speaker just spoke about Earned Income Tax Credit. For example, two pediatrics residents proposed an idea to operationalize Earned Income Tax Credit in their pediatric clinics. So for 5 years now, we've been doing people's taxes in the pediatrics clinics to sort of, have people be able to avail themselves of that. And we've gotten back, I don't know, $8-9 million, over these years for people. And so, and then we're taking that to another level by working with these families to leverage the HUD Family Self-Sufficiency Program that says people can earn more money and they don't fall off the cliff. The extra money goes into escrow for either home ownership or even education, because everyone in the family is eligible for it. So we're constantly, trying to operationalize things forward to to enable people to get towards self-sufficiency and financial security and that type of thing.
Any thoughts on how we would incentivize other people to do what you're doing? Because a lot of times when I see a hospital, I mean, they think immediately the physical wellness of the patient. They're coming in, they're either ill or they're, going to deliver a baby or something like that. We're going to take care of that problem, and then off you go. And we've done our part. You seem like you do an awful lot more in terms of thinking about the long-term health and outcome of the patients, and how do we set them on a better path going forward than just take care of the immediate problem.
Yeah, I think it's a transformation in even medical education kind of starts there, because it basically focuses on disease. Honestly, it just focuses on disease. It barely connects it to a human being. And when it does, it it presents an ideal human being who has an ideal life, unencumbered, unchallenged by anything, and particularly some kind of systemic barrier. And so, how we've tried to incorporate that in the culture of our healthcare system is, for example, when new doctors start as interns in June and July, they go through hospital-wide orientation to learn about the electronic medical record and patient quality and safety measures. But they also have to go through this, a determinants of health orientation, both in simulation as well as didactics. So we want them to be looking through that lens before they ever sit in front of a patient,
Wow.
so that they can understand from the very root what is driving whatever they're doing, because without knowing that, they will unintentionally, just be treating disease and not understanding what's driving it.
Thank you very much. Well, I'm like everybody else on this panel, Mr. Chairman. I could go on and on just asking questions. So I'll yield back because I know we have a lot of other people that want to participate. But thanks again for putting together the panel, great panel, and thank all of you for your testimony and sharing your observations and wisdom with us.
Thank you. Let me ask unanimous consent to insert into the record letters from two of our colleagues, Congresswoman Gwen Moore of Wisconsin and Congressman Gregorio Khalili Camacho Sablan of the Northern Mariana Islands. I consider both of them incredible partners in the fight to end hunger, and I appreciate their advocacy for policies that will help alleviate and ultimately end hunger once and for all. So without objection, I will include their statements in the record. Ms. Torres.
Thank you, Mr. Chairman, for hosting this very informative and very important hearing today. And I want to also extend my gratitude to the professionals that are with us today, providing some critical input on how we can address this, what I see as a growing issue of hunger in our community. First off, I want to say how uncomfortable it makes me when I hear a term, food insecurity. I think by continuing to call it out, to continue to call out hunger as being just food insecure, in my mind, we minimize the impact that has on not just children, but on our society as a whole. And as Americans, it is certainly a black eye, to our nation, to have children go hungry every single day, and not just children, but also adults. I want to pose a question to Ms. Reynolds. I just want to say how much I agree with so much of what you said, starting with weaving the safety net around the issue of providing food to people that are hungry. You talked about providing childcare. That is such a critical component to ensuring that parents are able to work and to get the type of jobs that are actually going to help them pay for the basic needs of their families. I happen to represent a community, a very working poor community, the Inland Empire. Our families struggle just to get to work every single day. They spend 2 or 3 hours one way in a commute, a terrible commute, which really leaves our local municipalities to struggle with this ongoing problem of people leaving, home, mass exodus at 5 a.m. and they don't return till 7 or 8 p.m. So what happens to the kids between 5 and 8 a.m. When they're supposed to be in school? I mean, let's just put the pandemic aside, and let's just talk about the past normal lives that we've had, and what happens to the kids between 3 p.m. and 7 p.m. You know, our communities are challenged every single day with having to provide before and after school programs for kids. So when a parent, you know, head of household is earning minimum wage, that leaves very little money left to spend on childcare. So childcare becomes this luxury that, you know, poor people see it as a luxury, but, you know, we see it as a threat to continuing this pipeline, you know, to prison, you know, that I think that we continue to feed. And it is so much more expensive to try to prevent recidivism, you know, at the tail end, when we can prevent children, you know, from having to go in that direction. So 4 out of the 6 school districts that I represent are in the 80 percentile of free and reduced meal. I think these are sort of old numbers, because some of my school districts have recognized that there's a lot of kids that whose parents are not applying for this free or reduced lunch. So it's easier for them. It makes more sense to just feed everyone, which I am thrilled that they have taken that attitude to just feed everyone. But I wonder if you know, our panelists can speak a little bit about, you know, that issue. The lack of graduation, our graduation rates, you know, are horrific. I'm ashamed to even, you know, call them out. But it is a growing problem, and it is not the fault of our teachers, you know, or our schools. It is the fault of society not paying attention to this growing problem of the working poor. It is not their problem, it is our problem. So I wonder, starting with Ms. Reynolds, can you comment a little bit, you know, around that? I know that you have said a lot around this issue, but look, we have an infrastructure bill that the president has put before us. And in that bill, the women of Congress, I want you to know that we are demanding that childcare be a part of that infrastructure bill. Because if we don't put families and children ahead of everything, a new road, a new bridge, you know, broadband isn't going to help us get out of these poverty levels that we are seeing in our communities. So with that, Ms. Reynolds, you know, if you can begin this conversation, I'd love to hear your comments around that.
Absolutely. And I love so much about what you said about prevention. We know prevention saves so much money, and it's more than about money. It's about human dignity when we can prevent people from experiencing these traumatic things that they experience that comes with poverty. So I love the concept of prevention. I just want us as a country to be brave enough to do it. I love how you brought up childcare, and it just, for me, really goes back to the point I made about the need for comprehensive services. I mean, we are not a bunch of little pieces, we are whole beings, and I will, probably the story that resonates the most with me about what you're talking about is a woman that we had the privilege to serve at Catholic Charities Fort Worth. Her name was Perla, and Perla came into our organization because of a very basic need. We said yes to that basic need because, again, if you don't take care of today, there's no tomorrow. But then we also offered a longer term journey out of poverty, about understanding what Perla's hopes and dreams and her bigger, brighter future was for her family. And her bigger, brighter future was a dream of a black suit. And I will never forget this, because Perla wanted a black suit because she envisioned at the end of the night sitting around her kitchen table with her husband and her son, and them being proud of her because of what she achieved that day. And so we set out at Catholic Charities to make Perla's bigger, brighter future of a black suit happen. But it fell short time and time again, because we would get Perla a job and she would leave. We'd get her a job and she would leave. And so it'd be really easy, if you weren't in relationship with Perla, to make a lot of assumptions that Perla's not real serious about that black suit. But the reality was Perla was very serious about that black suit, but she didn't have a living wage job at the time. And she would drive to drop her son off at childcare. And she would drop him off at a place that she did not feel comfortable with. And like all of us mamas on this call, I can't imagine the lump that formed in Paula's throat as she drove away, leaving her son somewhere that she may not have felt like he was going to be okay. And that was causing Perla to leave her job again and again. But again, because Catholic Charities was in relationship with her, because they were doing life with her, because Catholic Charities Fort Worth understood poverty is not just you just leap out of it because you get some sort of assistance, but that it is a day-by-day walk to achieve that bigger, brighter future. They knew the details of what was going on, and they were able to problem solve with Perla. And so in that specific case, they had Perla find a childcare center that she couldn't afford, but felt safe with. And then they matched dollar for dollar the money for Perla to be able to send her child there until Perla got to the place where she could afford that on her own. And I think this just brings up so many points to me of we have got to be comprehensive. We have got to be individualized. We have to be in relationship with people. You're right, Ms. Torres, we can't have families spending 2-3 hours transporting back and forth. It takes, the family is the core of society, and it takes away so much of that when we don't have those things in place. So it's my belief that all of these things need to be solved, but they need to come together in a comprehensive solution so we can really support families toward a long-term end goal of economic stability where they really are thriving as families.
So what you're saying is that, in essence, we really need a youth and family master plan for America. One that recognizes, public transportation, has to be a priority. One that recognizes, childcare and education and a livable wage and access, to healthcare. How do we do that? How do we find the courage, the political courage to say, this 35-year-old who is going to work every single day, maybe working 2 or 3 jobs, is deserving of food stamps, because the wage that person is earning, what that employer is willing to pay for that job, isn't enough for them to provide for themselves or even their families. Ms. Curry, can you speak a little bit to that?
Yeah, absolutely. I feel like, just going back to your previous question as well, I feel like there's so many layers here to just peel back. But for me, as a mom and coming from the hospitality industry, it really comes back to the food for me. Food is foundational. Food is nutrition. Food is healthcare, in my opinion. And so for me, I feel like there's some missed dots that need to be connected. And I feel like we're looking at it so big picture that we need to look at the small picture. And I think that there's some missing dots that we can connect here to help drive the change. You spoke to some people's commutes in your community being 2 to 3 hours. And that's between the hours of 3 and 8, you said. And for me, and then you talk about the graduation rates. And so in my head, for me, that goes back to knowing the facts that, children that are sitting around the dinner table with their families, are having bigger, brighter futures because they're doing better in school and having better education. And if these parents are commuting and missing out on that opportunity to gather with their children, something as simple as that, to give them this bigger, brighter future, that's so unfortunate. And it's something that, again, is so easily solvable right there. But how do we connect the dots with transportation and with childcare and nutrition at the forefront to make the change? And so, I think I have a lot of questions too. I know I'm not answering your question, but I do feel like, I just feel like there's a lot of dots that need to be connected on that front. And I'm hoping that it's something that somebody on this call can speak to, maybe Dr. James, from a nutritional standpoint, just, connecting those dots.
Dr. James.
Yes. Well, I think that just to answer that specific question, statistically, we all know that people who have lower income have lower health status, and so do their children because they're mere beneficiaries of their parents' resources.
Yeah.
And people who have lower education also, have lower health status and also don't live as long as everyone else does. And to sort of like get at that, I feel like the lowest hanging fruit always at every turn is to begin, particularly as we talk about the smaller picture versus the larger picture. The easiest thing is to ask the people who are living this experience themselves. Ask them. We don't have to sit around and make assumptions and come up with things. We can ask them, and they can tell us what it would take, for them not to have these issues and these problems. They could tell us what it would take for them to be able to literally just thrive. And I think one of the things we would learn from that is we jump all over the subsidies probably and not recognize and not use them as a solution, but more as a bridge. So I always feel like we should start with the people. The people can tell us. And I also go back to this question of I'm not so sure whether it generates any thought or whether it even makes a difference, when I ask a question like this. But I think it is really, really important for us to ask ourselves with everything that we intend to do. And I would say, again, starting with asking people first, but whatever solutions that we think are solutions and come up with, are we making a different decision when creating a different intent than we would choose for ourselves? I think that's foundational because we know what we need to thrive. So ask ourselves that to begin with, because that in and of itself will, tell us right away whether and what the intent's going to achieve, for sure. So I don't think, these things are basic, but I don't think we generally think that way. So, I think it requires that sort of level of a thought process, a transformation to thinking in that manner. So just two basic things, asking ourselves that and asking people with lived experience what it would take for them to be able to thrive.
Thank you for that. And before I turn it back over to Chairman McGovern, I just want to add and encourage my colleagues to shop at a grocery store in the poorest part of your community, of your district. I often do that. I love to, walk in and challenge the management of those stores. Why is the bread next to the beer? Why are certain things, that we know are not good for children, next to, the candy aisle, things like that. And why don't we have, access to more fruits and vegetables? There's a lot of, can items or microwavable food. I'm not trying to say anything negative around that, but the balanced nutrition that kids need in order to grow up healthy and be able to learn and do all of the things that we are asking them to do. Fresh food just isn't available for many of the people that I represent. Supermarkets, are far and few in between in these neighborhoods. So we need to challenge the corporate world, also corporate America, to invest in bringing fresh food into our communities. That's something that we should not neglect in this conversation. Community gardens are a great way to teach kids about proper nutrition and to help them learn how to grow their own food. But the reality is that is not a reality. Working people need to be able to go to the store and have access to fresh fruits and vegetables. And that simply is too big of a challenge in some of our communities. So with that, Mr. Chairman, thank you again for bringing light to this issue, and I will yield back to you.
Thank you. Ms. Fishbach.
Thank you very much. Thank you, Chairman McGovern, for putting this together. I really appreciate it. And thank you to all of the witnesses. Lots of good conversation, and I appreciate it. And I appreciate Chairman McGovern said there's no silver bullet. And we're hearing a lot of great programs about a lot of great programs. And Ranking Member Cole asked about maybe some principles that we could use to really focus things and how we could tailor it at the federal level. But one of the things that struck me is I'm hearing a lot about local innovation. You look at Dr. James and the things that are going on there, and my fear is that the federal government isn't good at local innovation, and that we really need the guidance in order to make sure that we are allowing that innovation to happen at the local level, because that's where, Dr. James talked about talking to the people. That's where you're talking to the people. And so we need to make sure that we do provide that. And so I'm just kind of, I guess, throwing it out as maybe as a discussion. And if anyone would want to respond, is maybe focusing on those principles. What would make sense for us to be looking at on the federal level? And I understand the whole issue of the holistic approach, but maybe how do we do that and create the innovation? Because there's wonderful programs. Ms. Reynolds talked about a great program, and I know that when I was in the Minnesota Senate, we talked about those kinds of local, and it never failed that when we tried to make it go statewide, it just didn't have the same oomph. So I'm kind of trying to find the answer to how do we make sure that we are continuing that innovation. And if anybody would like to respond, I know that's kind of a big kind of question, maybe more of a comment, but anyone like to respond to that, I'd love to hear.
I would like to step in, and hopefully this makes sense, but for me, it starts with agriculture. So with food insecurity, I feel like the produce, all of the things, they're already there. There's so much waste that happens each year in the farming community. So the food is there that can be distributed. So in my mind, it's how can the federal government incentivize these local farmers and agricultural communities to get that produce and food to the right spots, to those food deserts and to the destinations and to the places where people don't have that, because we can kind of bridge the gap there a little bit. So it's how do we incentivize, the farming community to get everything to the right places? Again, I'm all about the connecting dots. So how do we connect those dots to get the fruits and vegetables to the right place? And what incentives can we give that community? I think would be my question.
Thank you.
I would encourage rewarding successful outcomes. So one of the things today at LEO, we just launched a cohort of 7 new organizations who are local innovators in topics of income poverty, asset poverty, topics of community college completion, all sorts of things in all corners of our country. And they're going through a 3-day process, which they will learn all about impact evaluations and start designing their research projects. And these are organizations who have, are very local, very determined to achieve a certain outcome, and want a research shop to come and tell them about their impact, because there are many times social workers who got into this work because they wanted to see change happen, and now they want to understand if that change is what they think it is. And so what I would say is that what I would encourage is that more and more federal programs started pointing toward evidence, that where evidence exists, using it, or where evidence doesn't exist, making sure that evidence is built. And I think the way that is built is through the federal government saying, this is what we want to achieve. And then local innovators say, I will achieve this outcome, and they run their intervention that then is tested by, again, economists and other academics who can bring that research rigor to the table. So that's how I think about it.
And if I could just add a few more things. One is this recognizing that having a strong foundation of income support programs and federal nutrition assistance programs really helps the local innovators have the space to do the work that they do best, which is understanding how to address the root causes of poverty. But they're much more stretched if there's a line around the corner where everybody just needs sort of a basic amount of food. And so when we're building on top of strong basic programs, then we can do the innovation, we can do the studies, we could have the White House conference where we share ideas and sort of learn best practices and you sort of share knowledge.
Thank you. I appreciate that. And then just one other question, and I'll throw it out to everybody, but where do you see the role of the private sector in some of this? I guess because we're talking a lot about the federal government coming in and doing different things, but there's got to be a role for the private sector.
Well, I would like to just add one thing to answer that question. As a hospital, we realize that hospitals can't achieve these things alone. And so we have not achieved them alone. We have recognized that it requires multi-sector partnerships to be able to do this. And, partnerships among not only hospitals, which is kind of unprecedented, but the hospitals in our city have invested together as anchor organizations that actually belong to a DC-based organization called Healthcare Anchor Network that focuses on building more inclusive, sustainable local economies. But also working with banks, we worked with JP Morgan Chase, for example, to create an ecosystem in an area that is traditionally been disinvested, to create opportunities for ownership of businesses and equity ownership in these businesses and this type of thing. And also philanthropy. We also, talk to, people who are philanthropically oriented to help to build this thing, and government. I would say state and local, city and state government as well. We've worked with them as well. And in fact, that program, that's what I just referenced about JP Morgan Chase, that is a multi-sector project that we are doing, and the city is very much a part of it. It's the Department of Economic Development, from the city of Boston, for example, and other hospitals, and people who are involved in career training and financial literacy for people. So I would say multi-sector partnering, it's a very, very good question. Multi-sector partnering is the best way to leverage resources and assets to achieve common goals.
I would like to second what Dr. James said. It's really not about reinventing the wheel because there are so many small local places doing great things. So it's really about helping to amplify those strategies and structures that are already in place.
I'll add a few other things that the private sector plays in this space. So for example, in my work with the Greater Chicago Food Depository, I know that we send our trucks out to deliver food to the local food pantries, and then on their way back, they stop by participating restaurants and stores that have fresh foods that they discard at the end of the day. Well, they don't discard them anymore. They give them to us, and then we repurpose them, getting them out. So that's one great example. Of course, lots of grocery stores, make substantial donations to food banks, food pantries, especially when they're, when the expiration dates are getting close, but aren't here yet. So of course the food's still safe, but the grocery stores know what they need to do to keep the food moving, and they've been very generous, and they've been a tremendously important partner in terms of making sure that people get fed.
Well, thank you very much, and Mr. Chair, I yield back.
Thank you very much, Mr. Perlmutter.
Just quickly, I appreciate the questions that have been asked and the panelists' testimony today. And I'm taking away from this two things, or several things, but a holistic view of the individual, the person and their family, and what's got them in this position. And I mean, the chairman has started off with a gigantic subject, which is hunger. And in effect, we've expanded that in a number of ways beyond that discussion. But I'm looking at it as a holistic kind of approach: housing and poverty, income and food. I agree with Norma. Food insecurity kind of glosses over what I feel is the question of hunger. So holistic view of how to approach it with a federal overlay, state and local government, private sector, individuals, charities, to try and as efficiently as possible bring relief here. So that's the second place. Ms. Jansenbach, you raised Milton Friedman, who I never really put him in this category. And so I'm kind of interested to ask you that, because I've always thought of Milton Friedman as there's no such thing as a free lunch, a pretty rough character who was not particularly, I never even thought of him in these terms of hunger. So could you expand on that a little bit? And with that, I'd like to yield my limitless time after that to whoever comes after me.
Yeah, I really do promise. I have my students read Capitalism and Freedom. Just one of the last chapters is all about how would you design an anti-poverty program. And he, takes a step back and, thinks about incentives and, how do we make sure that that as we're phasing out benefits, because we do have to phase them out eventually, right? We call that the old iron triangle, right? If you give them to everyone, it costs a lot more money. And so you've got to phase them out at some rate. And so, he thinks about what's the rate, at which we should phase it out. You might have heard of, he called it the negative income tax. And in fact, during the Nixon administration, they ran some real randomized controlled experiments on the negative income tax, found some really important findings from that, that did some real good. And then I really will say that a lot of our programs are based on that same sort of foundational way to design programs, and it works.
Well, all I can say is you're a lot nicer than Milton Friedman. So, you're putting a nice component to sort of his economic principles, where I think there are two things going on here. Milton Friedman would be more of a monetary policist. He just focused on in particular incentives, but there also has to be setting these goals and directing it in a fiscal way, which then can put some power behind the incentives, that this is the direction we want to go. And I know the chairman's goal here is let's eradicate hunger. And it's going to take about everything we've got to do that. I know in a wealthy country like ours, we should be able to do it, but it really is going to take a good look at the individual and a holistic approach involving all of government, the private sector, and hospitals, where there are good ideas. So I'm going to yield back to the chair, but if Ms. Scanlon wanted to grab my time, or I don't want to give it to Mr. Morelli because he'll use it forever, I will yield back to the chair.
So I should say to the witnesses, Mr. Perlmutter is kind of joking about his limitless time. But as you probably have figured out by now, the Rules Committee is a little bit different than other committees. In other committees, question and answers are within 5 minutes, which is good and bad. It's good because you get the hearing over with. It's bad because sometimes you can't have the kinds of conversations that we're having here today. And I think these conversations are incredibly important. And again, the Rules Committee, every bill that comes to the floor goes to us. We're like, I don't know, like the Wizard of Oz. I mean, no one quite knows what we all do here. But the bottom line is that we bring everything together. And so we're the perfect committee to kind of head this effort up. And again, I go back to the White House conference. There's lots of different ideas that are being talked about here today. Ms. Curry talked about connecting the dots, which is incredibly important. It's hard to connect the dots in the system that we have because we only talk about little bits and pieces of this depending on what committee you're on. And so that would be the hope of the White House Conference, similar to the select committee that George McGovern and Bob Dole, were on. The White House Conference could be that vehicle to connect the dots, to bring all this together, and to develop a roadmap that involves everybody. I mean, not just government, the private sector, medical institutions, educational institutions, everybody. And so I appreciate that. So I'm now happy to yield to Ms. Scanlon of Pennsylvania.
Thank you so much, Chairman McGovern. As you know, I've been really looking forward to this hearing. Sorry, just pulling things up as I am bouncing between too many hearings. So I just need 1 second. So I've had a fair amount of engagement in this area over time, working with community gardens and local food banks. I was on a school board where we were implementing the 2010 nutrition regulations for school breakfasts and lunches. And I represent Philadelphia, which is the poorest of our large cities. And therefore, I think the statistics pre-pandemic were that we had 1 in 4 people in our city were hungry. So this is a long-standing issue for the region that I represent. Obviously, during COVID-19, our food banks have seen a huge increase. I think 60% is the figure that we see, a huge increase in need, with a lot of people having to turn to food banks for the first time ever. Since the pandemic began, I've made a point of attending food drives, food distributions, and farm markets just about every week or weekend in our district. So I've been able to talk to a lot of our constituents as well as people who are doing what they can to try to meet this need. But as Dr. James suggested earlier, for many people, dependency on food banks has become a constant, even pre-pandemic. We have great local organizations that have been fighting hunger in the Philadelphia area. Folks like the Greater Philadelphia Coalition Against Hunger, Philabundance, which began as an organization that collected food from corporations and other places that had excess food to distribute it, but now it's our major food bank in the region. And then we've had Delaware County's Human Services and Citizens Corps. Almost every weekend they have a food drive-through where the local food banks come, open the back of their car, take what they need, and then go use it. I've got a constituent, Desiree Lamar Murphy, who runs a food pantry in her backyard every week for her neighbors. So we're really grateful to all those folks who've stepped up, but we need to address the underlying issues as we've been talking about here today. We need additional funding for the food banks. We need to make sure that the safety net is there and working when people need it. And I'm really encouraged by the way we have been able to implement programs throughout the pandemic, whether it was increasing SNAP benefits, providing summer lunches to schools, to students who wouldn't otherwise have access to food, expanding the child tax credit, and taking some of these other measures that I think do need to be made permanent. So obviously, as a school board member, I've had a strong interest in the school lunch, school breakfast program, what we can do to make sure that's more nutritious. And I am concerned about the fact that we saw some rollback in those regulations in the last couple years. But there are additional issues we need to introduce there. And I'm also interested in the WIC program. I'm a member of the Black Maternal Health Caucus. And we know that the US has such a terrible track record, much worse than any of our peer nations with respect to maternal mortality. And I understand there's some things we could do with WIC that might help address some of those issues. Good news is we have a base to work from. The work that was done 50 years ago and programs like SNAP and WIC do exist and give us some place to start, which is great. Dr. Schatzenbach, Can you talk a little bit about how WIC and the child tax credit may be helpful with respect to the issue of social determinants of health, maternal mortality, infant hunger?
Yes, so we absolutely know that early life period, sort of from in utero through age 3 or 5, is just extremely important. It's extremely important for brain development. You know, our number one priority, frankly, should be protecting people in that age range, especially in times of economic downturn. And let me say clearly, we did an exceptionally poor job of that during COVID. We know that that is important, and nonetheless, we let rates of hunger increase more for families with kids. But we do have programs. I'm extremely excited about the potential for the child tax credit, which we think will half child poverty next year. And as another feature of that, which will be really useful, is that it's paid out on a monthly basis. And so that means that when families sort of get into a bind at the end of the month, they're going to still have money. They don't have to wait until their next tax payment in February or March. So I think that's going to do some real good. Now let's talk about WIC for a minute. There's a lot, of course, to admire about this program, but I do think that it's in need of some modernization or some incentives, frankly. So it does a fantastic job with making sure that infants in the United States have access to the formula or the breast milk that they need. Participation rates are very high. Something like 80% of infants who are eligible participate. But where it falls short is both in those prenatal conditions, which we know that if maternal nutrition is adequate, the baby's going to be born, at a healthier birth weight. There's all sorts of, health problems down the road that get sort of headed off if mom's in good health. And then similarly, participation rates really drop off dramatically as kids get age 1, 2, 3, and 4, even though we know how important it is to protect kids in that age range from hunger. And furthermore, there's this gap, right? So you age out at WIC on your 5th birthday. Sometimes you're not in kindergarten for another couple of months. And so, there's just nothing, right? Even though we know how preciously important this time is. So I think it's in my comments in the record. It's past time to set up performance standard for WIC, and we can let states and local areas figure out how to address why is participation falling off so much, but some incentives I think will go a long way there.
Thank you. I think you also wrote some about SNAP and how we need to work on recalculating the amounts that are necessary to produce or to put healthy food on people's tables. Can you talk about that a little bit?
Oh, yes. Thank you for that question. So we are in the midst of rethinking the Thrifty Food Plan. You might remember that Congress ordered the Department of Agriculture to take a look at the Thrifty Food Plan as part of the last farm bill, and they sort of dragged their feet a little bit on that. So let me just sort of paint a little bit of a picture for you. Basically, no matter how hard they try, the Department of Agriculture can't figure out a way to make the numbers add up. So sort of make you have, or capable of purchasing a healthy diet for the amount of money that they have, and so. They try, right? And so my favorite example is that the Thrifty Food Plan calls for a family of 4 to drink over 20 pounds of orange juice per week, every week, and to top that off with 5 more pounds of fresh oranges. Now I love orange juice. I'm sure you do too. That's about 5 times what families actually consume. Similarly, the plan calls for more than twice the normal weekly consumption of milk, of potatoes, of rice, of bananas. So it'll go a long way to sort of have this Thrifty Food Plan, a more reality-based plan. Another one of my favorite examples is it assumes that it costs the same amount to feed a toddler as it does a teenager. And let me tell you, I got 2 teenage boys in my house. That is empirically false. teenage boys are a lot more expensive to feed. So, I know that the Department of Agriculture is working hard on this, let's, relook at the Thrifty Food Plan and make it more based in reality. And I think that is going to go a long way to this goal that we have of ending hunger.
That sounds right. Having had teenage boys in our house, I could not agree with you more. One of the, you mentioned, I think several people have mentioned the impact on academic performance for when children are hungry. And we've talked a little bit about in the K through 12 context, but I've got 19 colleges and universities in my district. And I had not realized before getting into this line of work what an issue it is to have hunger on college campuses. And the fact that most of our colleges now have to have a food pantry to keep people fed. Have you looked at that issue at all?
I agree that that's extremely important. It harkens back to that 1968 documentary, Hunger in America, that the chairman started by quoting from. I'll always remember that one of the quotes from that was that the mind comes in second when the belly is empty. And so to be sure, we see that having access to SNAP, having more consistent access to SNAP, all of those things, mean that kids do better in school. So when it comes to colleges, that is, there's just a lot of thorny issues around that. It is definitely the case that the college rules for SNAP are antiquated and just aren't reflecting the fact that many people are going back to college. It's not just 18 to 22-year-olds who are in college anymore. A large fraction are over age 25. Even 10% I think are over age 40. And so I do think that we need to take a careful look at do we have those right? I know that there were some change in in some of the relief packages, but we need to sort of take that on more systematically, because the last thing we want is for people not to finish their degrees, which can then be a path to sort of better jobs, more stability, because they can't feed their stomach in the very short run.
And if I could just add one point to that comment, and is that, there has been a growing body of evidence over the last decade on what it takes to get people to persist and to complete their college degree. I think that there's been about 6 RCTs that show, successful interventions that are working. And a common thread is helping college students, low-income college students, deal with personal barriers, poverty obstacles that they're dealing with. And so where we've done a great job as a nation, like getting to the point of access, we just have so much further to go with persistence and completion. And so much of it is because, again, if you are in poverty and you don't know how you're going to feed your child tonight and you're in school, education is going to be the first thing to go if you can't first take care of today's needs.
I'd like to build on that a little bit, and just provide a little bit of perspective from the fact that it's true. Every school should have some sort of a food pantry when it comes to college education, because I think it's just ironic, when you look at needing to focus, that food really is medicine. But it seems as though it's easier for college students these days to have access to an Adderall prescription rather than some brain fuel from, their local college food pantry. So I think that really is something to look into.
Okay, thank you. Playing off the theme that food is medicine, I was going to direct a question to Dr. James. I know at CHOP, Children's Hospital in Philadelphia a few years ago, they initiated a program, yet another PPP program for my congressional colleagues, but this one is the Prescription Produce Program. So trying to address nutritional needs of children by prescribing produce and other healthy foods to them. Is that related to some of the things you're doing in your program, Dr. James? I think
thank you. I'm sorry. In at least one of them for sure, and as well as the food pantry, because we have the Grow Clinic, and one of the things it does is prescribe the sorts of nutrition heavy foods that children need to actually grow. We've seen countless, every year we have a fundraising event, seen countless look at me now stories, from a picture of a little baby to a grown person in college even. And part of what goes along with that program is not only providing people with access to those nutritional foods, but we have, as I was mentioning earlier, a teaching kitchen that actually helps people to prepare those types of foods. And actually, not only in one way of preparing it, we have the most diverse patient population in our city. And so, there are ways of teaching people and orienting them to actually prepare these healthy foods in their own cultural sorts of ways as well. So we first of all provide them with access to these nutritional foods, and then also help them with learning about how to prepare them. So it sort of runs, the entire gamut.
I mean, one thing that kind of has masked some of the hunger issues in our country is we also have this obesity issue moving forward. Can you speak a little bit to how someone could, be obese but not be getting adequate nutritional food? I mean, we've seen in the school lunch contract that as we rolled out healthier alternatives, it started to address some of the obesity issues because kids were eating better and not eating so much junk. Can you talk to that, Link?
Your obesity is complex. It's a really complex thing. First of all, what might be considered obesity in one culture may not be considered obesity in another culture. And so, we create these sort of standards by which we, measure people. And in some healthcare settings, the honest to truth, judge people, and it's not really good because the patients feel that. I actually saw it. I saw a doctor have tweet about that the other day about how she herself was not enjoying being a doctor because of the perceptions people have about obesity. And she considered herself that, I guess. But so I think it's that's first of all. And I mean, I actually once did a study on that in our emergency department, asking people whether or not they consider themselves obese, first of all. And I know I'm not getting to your question yet, but I will. We were asking people whether or not they consider themselves obese, and then we measured their BMIs and things like that. And there was a huge discrepancies in what people considered as obese and not, based on culture. And the other thing I asked people was, would they ever be interested in, exercising, learning about health and fitness and this type thing? And 85% of the respondents said they would absolutely be interested in those things if they could just manage the stress in their lives first. And those things were all focused on like food insecurity, housing insecurity, lack of resources to be able to even prioritize, their health. And so a lot of, the things that people have access to eat, to answer your question, they're just things that aren't things that add nutritional value. They may be things that just pack on calories, they may be things that are just like heavy in like carbohydrates, heavy in sugars and this type of thing. And so and listen, I have always been had this notion in my head. Actually, it's a mantra, and it is given any opportunity, barring things like, with the exception of mental illness and substance use disorder, barring any, given any opportunity, people will not choose suffering. And so there is always a reason, for these things but we just have to understand and take the opportunity to understand what the reason is, and just by asking people themselves.
I suspect you may agree with a pediatrician in Philadelphia who wrote an op-ed a little over a year ago. He said that a friend asked me the other day what would do the most to improve the health of the children he sees in his clinic. And he said, raise the minimum wage. And it speaks to these other issues, the fact that people have so much on their plate and they can't afford the housing or the medication. And it's just this cascade of things, including food insecurity. So I have found that something I cite quite a bit. Going back to Dr. Schatzenbach, one of the things you were mentioning, reducing barriers and access to nutritious food. And that's something we tried to work on over the summer. trying to make the ties between farm markets and our local populations, making sure that people could use SNAP and EBT at the farm markets, that folks could get deliveries from the farm markets. Are there other things in that reducing barriers to access that we should be looking at?
I think sort of after, besides, expanding access in farmers markets and things like that, and delivery, both of those I think are pretty first order. Another is, about a decade ago, the Department of Agriculture ran a randomized controlled trial, so really, top quality evidence about what happens when we give people a price break when they buy fruits and vegetables. And so we'll give them 30 cents back for every dollar they spend. So recognizing that costs of these are, have been increasing disproportionately. Lo and behold, maybe to no one's great surprise, it increased the likelihood, that increased the amount of fruits and vegetables that people buy. I think that is more than ripe for prime time, and I would love to see us implement that sort of on a large scale through the SNAP program.
That's great. Ms. Curry, you've done a lot of work around school food programs, and I spent some time in the trenches on that one as well. Whether it was trying to make sure the kids who were using the free and reduced lunch and breakfast didn't feel stigmatized, making sure that the quality of the food was good, et cetera. Can you speak to what you're seeing in that realm and how we could do better?
Yes, absolutely. So it's so interesting in speaking about obesity. Oakland actually has high obesity rates and high rates of food insecurity, and it seems so counterintuitive, but they're definitely linked. And it's because healthy food is more expensive than the other things that people have access to. And so I think what you were speaking to is great with the incentivizing, the 30 cents back for every dollar, I think is a great thing to implement. But what we've found to be really helpful for us to change that is to working with getting these local organizations like ourselves to work with the local farmers to actually bring the produce to the schools and the different school districts and to the people in the communities that way. And just kind of have this direct to consumer model, I think has been very helpful for us on the ground. And we find that people, they they want the healthy foods. They just don't have access to them or can't afford them. And so kind of bridging that gap, I think has been really helpful in our eyes. And we've found people to be really grateful for the help.
You also had some interesting statements in your statement about philanthropy cannot solve everything, and I've certainly been concerned about that. Attending food drives where the pantries that show up at those food drives are dependent on whatever happens to come in that day. Can you speak to that a little bit?
Absolutely. So you're saying that people receiving whatever comes in that day through, yeah, absolutely. We're completely, dependent upon people volunteering and showing up to help and to really be boots on the ground. And people kind of take what they can get, and that's the sad truth of it. But we've been fortunate that we are here in California and have had some amazing local farmers and dairy providers come and help. And we've also implemented having our local hospital, like Kaiser Permanente, have a huge help. And I found that to be extremely helpful from both a mental health perspective for the community and nutrition. And so I would encourage, us to figure out how to connect other local nonprofits with their local hospitals, because I feel like it makes a huge difference in amplifying. And I think awareness is a huge thing too. A lot of people don't realize that the help is there. And so figuring out how to raise more awareness about the help that's available to the community, I think is really important. And for us, partners like Kaiser and our local food bank have really, really helped in doing that. So again, I hate to repeat myself, but really connecting those dots on the small things has been so important for us from the ground level up.
And I think that goes back to the barriers issue and particularly when we've had to rely so much on internet and not everybody has access, but that would keep me going on for a lot longer. So thank you very much, and I will yield back.
Thank you. Before I yield to Mr. Raskin, I just want to ask unanimous consent to put into the record a statement from Luis Pedraja, who's the president of Quinsigamond Community College in my hometown of Worcester, Massachusetts. He wrote to tell me how students are facing food insecurity today at levels obviously compounded by the COVID pandemic. And let me quote, he says, prior to the COVID-19 pandemic, a 2018 study done by the Wisconsin Hope Lab found that 49% of students had low or very low food security and went hungry on a regular basis. 11% were homeless and 54% were in an insecure housing situation. Shockingly, 7% of students experienced hunger, housing, and homelessness together, all three, while 66% experienced one of these basic needs, insecurity. And the pandemic has only compounded these concerns, end of quote. So nobody is immune from this crisis, and we have to act. And then, by the way, this statement was submitted through the Rules Committee's new online portal at rules.house.gov. I want to encourage anybody who's watching this today to take a moment to log on and share your story, any research you have, or whatever you think we should know as we continue this work. And again, I think the conversation has been really superb, but it all points to the same thing. We have a hunger problem in this country. And it involves not just one program or not just the government, it involves all of us. And again, part of what we're trying to do here is to highlight, some of the challenges, but also move toward, again, connecting the dots, as Ms. Curry says, because I think that is how we solve this. This is a big problem. It's going to require some big thinking, and we have to again get everybody who has a role together and figure out what our roadmap is going to be. So, having said that, I'm now happy to yield to the gentleman from Maryland, Mr. Raskin.
Thank you, Chairman McGovern, and thanks for convening this excellent discussion. And I want to express my appreciation to the panelists for their really terrific contributions. My congressional district in Maryland is in certainly the top 25% of congressional districts in terms of wealth in Montgomery County, Maryland, and Frederick County, and Carroll County. But I've been very focused on this issue, and we've seen some terrible outbreaks of hunger and poverty over the course of the COVID epidemic. And one way of seeing it is with a group that I've worked with for a long time called Adventist Community Services of Greater Washington, which is not far from my house. They basically went, during the course of the first several months of the crisis, they started serving 10 times the number of people as they had seen a year before. And then whole new groups arose. In our school area, we call it the Tacoma Park Middle School Cluster, a new food support group was founded by my friend Wendy Kent. They started by serving 33 families a month, and they went to serving thousands of meals a month because the demand was so overwhelming, with people skipping meals and not able to feed their families nutritious lunch and dinner. So it's a serious problem, even in areas that sound to you like they might not have a problem, like Montgomery County, Maryland. The question that I want to ask, given this amazing outpouring of human compassion and solidarity that we saw, not just in Montgomery County, but in Frederick County and Carroll County and throughout, is whether we should continue to depend on that. In other words, do we want to work with and mobilize these networks that have formed in our area around school clusters, or is that a manifestation of the failure of our broader food systems and failure of the government? So I'm just curious as to how you integrate the emergence in civil society of efforts to transfer, you know, grocery gift cards and canned goods and fruits and vegetables from farmers market directly to people who are hungry, versus trying to think of it as a more systemic issue. And I don't know, Dr. Schanzenbach, maybe we could start with you.
Yeah, you know, great questions, and it was certainly heartening to see just the overwhelming response, you know, when need surged so much. I do think that we'll want to continue to nurture these networks, but you know, the expectation and hope is that as the economy continues to improve, as we sort of fix some of the shortcomings of SNAP, just the pressure will be taken off of those. And so then we can, you know, really turn to thinking about some of the more, you know, fundamental causes of, you know, why you're having trouble making ends meet. You know, what can we do sort of, you know, to be more sustainable here? But I do think, of course, we want local organizations, we want grassroots people to be part of the solution. I think we're going to need them to be part of the solution.
Yeah.
But they're going to be better on top of SNAP.
Well, and Ms. Curry, I wonder if you would reflect for a moment about the dynamics of the kinds of things that have happened in my community, and I'm sure it's not unique across the country. It's wonderful to be part of food drives where, you know, people are bringing food, people are bringing canned goods, people are contributing money. Then there have been like drive-throughs where people come up, we hand them bags of groceries and so on. Is that ultimately what anti-hunger initiatives should look like in America, or do we want something that is more systemic and more structural and more sustained to be taking place? And what are the dynamics in terms of how people feel about it, both the people who participate in giving and the people who participate in receiving? Is it better to have that kind of face-to-face thing? Is it embarrassing? I'm just curious.
Right. I definitely think that programs like ours and many others should definitely continue going forward with the added benefit of the strengthened SNAP program. But I would say I haven't seen embarrassment, as you said. I've seen more graciousness and gratefulness from family perspective, especially during this time. And you know, what happened here was a pandemic. So we had to do what we had to do and get things to people the way that we needed to get them as fast as we could. And so that model really worked for us. And with our partnership with the World Central Kitchen, who has implemented this same program in many different places, it just works. And it has that back end benefit of helping the hospitality industry as well. And so that part of things has been really great structurally. But I think systemically, absolutely, it would make more sense to have more structure there. But I think that there's a world where both things can live, because we're not going to, until we see this completely end, I feel like we're going to need all of the help that we can get, and then some. And when this pandemic ends, we're not going to see, unfortunately, this go away right away. If anything, I think it'll get worse, a little bit worse before it gets better, because we'll be in that rebuild stage. So I think it's really important to have, you know, strong forces behind the hunger initiative to make sure that we're taking care of everyone until we get to a place where we know that the SNAP and WIC programs that are put into place are truly working. If that answers your question.
Yeah, no, I want to thank you for what all of you are doing. I want to thank Adventist Community Services in my area, and I want to thank Wendy Kent from the Tacoma Park Middle School Food Support Cluster, and I want to thank everybody who has stepped up at this moment. Let's just hope that we will be able, through these different legislative initiatives, to strengthen the overall resiliency of our nutrition network in the country. I go back to Mr. Chairman.
Thank you very much. I want to ask unanimous consent to insert into the record a letter from the Food Bank Coalition of Massachusetts in support of today's hearing and the need to convene a White House conference on food, nutrition, and hunger, and our goal to end hunger in the United States by 2030. I'm now happy to yield to Mr. Morelli.
Thank you, Mr. Chairman. First of all, not only for convening this hearing today, which is so important at this point in our nation's history, but your long history of working on this. And I'm very, very grateful to you for your leadership, and to all the witnesses who have stayed now through a couple of hours plus answering our questions. And I think that the questions have been great. I think the subject's important. I actually was going to ask something about hunger, but I've been inspired by the chairman's call to talk about this in a bigger way. And I was also inspired by Ms. Curry's story about Christina, I think she said the young woman's name is. So if I can just take a moment, 4 years ago, I was the majority leader of the New York State Assembly, and we had just come through a bruising state budget battle. We passed our budget, adopted in April. And what I was frustrated by was how many different groups, well-deserving, well-meaning, came to ask for money. And I represent Rochester, New York, upstate New York, second highest child poverty rate in the country, sadly. But I was reflecting on my frustrations. There were so many people, sometimes in the same space, asking for state funds. And I was thinking about, boy, we're doing so well. All these groups would come and say, we get so much return on our investment. If you invest $1, you get $3 back in avoided costs. And I thought, all these services are great. All these organizations, will claim to be so successful, but in some ways, we're not helping people. It's just people are getting worse. Our situation in our community was getting worse. And I thought it's like the organs of the body are doing well, but the patient is dying. And so I was haunted too by a story, and this is the story part. My wife was a English language arts teacher in 7th grade. And we were near the end of the school year, this time of year. And she had come home talking about this boy, Dasani. And Dasani had been one of her favorite students. 12 years old, a lot of personality, very smart, but there was some issues in Dasani's life. And she came home one day, and she had talked about him a lot, so I knew who she was talking about. She said, Dasani got suspended from school today. And I said, oh, I'm sorry to hear that. What happened? She said, well, he got in a fight with some other students because they were teasing him. He's been sleeping on the playground and sneaking into school buildings at night rather than going home. And I said, gee, that's unfair. Why would he be doing that? And she said, well, his older brother, who my wife had also taught, had been killed in a gang-related shooting. And the mom, she was a single mom, was having mental issues dealing with her son's death and the violent way in which he died. So I said, what's going to happen to him? And she said, I don't know. And she never saw him again. So I was haunted by that story and haunted by what had been this bruising state budget battle. So I convened in my office at the time, the local United Way, my 2 major hospital healthcare systems, and the Rochester City School District, which has had all kinds of challenges. It's an urban district, very, very poor achievement rates. And I said to them, I don't understand why as adults, well-meaning, caring adults with a lot of services, why we have these terrible results and why we don't integrate social, health, and educational services. Why a classroom teacher doesn't know that a child that they have and their family, connected family, have housing issues, have food insecurity. When you go to discharge folks from the emergency room at our hospitals, I would hear the emergency room attendants tell me, we didn't discharge the person, not because of a medical reason. We don't know what's going to happen to them, and they're on the precipice of falling apart. So I challenged these 4 or 5 people gathered around my room. So 4 years later, I just want to talk about what we've done in Rochester, New York. We have now 50 organizations that meet every month for several hours. I have work groups with hundreds of people. We have a staff of about 6, 7. It continues to grow because I convinced the state of New York to allow me to start creating a pilot program in Rochester to start integrating services, health, education, and welfare, not to create a single program. There's plenty of silos. It's just the silos aren't connected in any meaningful way. So we've been at it for 4 years. We're about to enter into a big agreement. We were funded by the state of New York, gave us $15 million to integrate services. So we've built a shared language protocol, an ecosystem. We've gotten all these different agencies in the health, social, and educational space to agree to share data with one another. And we are building, again, no new services. It's really about alignment and integration. But out of that, what we hope to build, and we've got pilots we're about to implement, a holistic, human-centered design with a big lens towards racial equity. We have an equity review board that looks at everything. Even the algorithms we're building with IBM, who's our selected vendor, we brought in a company to look at the algorithms to make sure there's not racial bias in the algorithms. We have a huge community engagement piece to this. But the frustration, and this really gets to what the chairman was talking about, is when I describe this, part of the value I bring to it, so I co-chair this with another longtime friend who's a member of the State Board of Regents and is in the healthcare space. And so I bring these folks together and I spend hours on this every month. And the real kind of reason I'm there is I don't know that much about healthcare policy or educational policy or housing or hunger, but they'll come to meetings if then the majority leader of the assembly convene them, or now the congressman convenes them. And so what I do is I troubleshoot when one of the hospitals is thinking maybe they're going to design something that deals with social determinants. I call the head of the hospital. I said, you've been in these meetings, you know this is important, you're committed to this collective work. So they'll go and make sure that people are brought in, and we've continued. That's why we have hundreds of people now working on work groups. So we're on the cusp. It's really hard. I mean, we talk about this in rooms like this, virtual or otherwise, and it sounds easier than it is, but I know all of you know how really difficult it is. You deal with egos, you deal with programs that are designed for, 10 to 12-year-olds, but then when you become 13, you might still be hungry and you might still be homeless, but you're no longer in that program. So we don't have really good funding streams. But the worst part about it, and Jim, you mentioned this, and this is why I'm getting so animated about it, is if I weren't in that room, I'm not sure it would work well in Rochester, New York, because, I sort of say I'm the muscle in the family. I make sure everybody's at the meeting. Now they've gotten to the point after 4 years where they work together. There's faith, there's trust. We're all part of this belief system that we're going to change the world, and we're going to have the first fully integrated health, social, and educational services. And the hospitals talk to social, and there will be no what we call warm handoffs, and there's no one will fall through the cracks. You're at one settlement house, and then your family moves, and now no one knows what happened to you. All the whatever information about you while you're at the settlement house was great, except you moved to a new neighborhood and no one knows who you are, and no one knows what interventions have happened in your life or your family's life. So I relate this not because I'm pessimistic, I'm very optimistic. I mean, we're doing some things. We've consulted with San Diego 211, which is doing some great things. We know about the project in Fort Worth, Ms. Reynolds, that you talked about. But I guess the question then I think we should all sort of be contemplating is how to build, and maybe it's when I talk to, I'll just say this one other thing, and I'll get to the question, sorry. When I talk to folks in the Ed and Labor Committee staff, of which I'm a member, or I talk to other folks in public policy, and I say to them, we really need to break down barriers and bring people together in a holistic way. And I think everybody sort of intuitively says, boy, that's really what we're all trying to do, right? But the way we design things in government and public policy makes it almost impossible. I'm going to have a fight tomorrow with the state of New York about some requirements on how we enter into this agreement with our integrator, because they just don't, they helped me invent the program. They came up with the funding. They still don't know how to do this because they're stuck in the old way. So I guess the question is, maybe less for right now, but something to think about and help us with is how to really have a serious conversation about true integration. That those silos that we've built, well-meaning people over decades and decades because there was a problem they wanted to address, how do we break it down? How do we create regional or state approaches that really worry about a community, but really at the end of the day, worry about the individual and the families? Because for all the other things that we do, if we're not, and moving people from crisis and the fragility that poverty puts on people to, I heard the word self-sufficient. I don't want to get people self-sufficient. I want them to thrive well beyond self-sufficiency. So they're thriving. They don't fall back into poverty. They don't fall back from, they're out of the program for 2 weeks. They get a flat tire. They lose their job because the third time they've been late for work. They're now back in poverty again. So we've got to do much more than just getting them over some arbitrary line, the poverty line. We've got to get them in a whole different place. So sorry for the rambling, Mr. Chairman. I really apologize for that. But this is something that, you know, I and so many people here in town have dedicated themselves to. But it's tough. It's a slog to even get people to think creatively about how do we break this down? How do we truly get to integrated, holistic solutions? With that, I'm going to shut up, and maybe I could just ask each of you to just offer a little thought about things that we could do to make that better.
Well, why don't we begin with Dr. James?
Mr. Morelli, I just want to really congratulate you on this really upstream transformational way of thinking, you know, really focusing on root cause. I want to thank you for not accepting the status quo, you know, but believing it can be better and being willing to push that. And I like the notion of pushing toward equity. And here's the thing about equity that I've discovered is that equity is really tricky. I like the way that you kept, you know, emphasizing well-meaning people. We are indeed well-meaning people, you know, well-meaning and even as well-meaning people, when we don't, or if we're not able to recognize inequity when we see it, even when we might be inadvertently participating in it, it's hard to create something that reflects equity because we don't know what inequity looks like. And, you know, there have been some recent examples of that, you know, for example. So, you know, it takes a lot to actually focus on equity first. And so I would say that a lot in this city right here, the hospitals have been working together really, really well, and especially since 2019 when we did a community needs health assessment together. And then we created what emerged from those needs assessments became our community health improvement plan. These are things that are required by the Affordable Care Act every 3 years. And so in achieving something that you're actually talking about right now, you know, our goal and our aim was to push toward equity. For our own hospital, one of the first things we did when we decided that we would choose equity over charity exclusively was to look inside ourselves, look at our policies and programs and outcomes to see where we might be inadvertently participating in things that reflect inequity. And to nobody's surprise, of course, we found things, but that's what we wanted because that's the sort of information we needed and insight we needed to be able to choose a path that reflects equity. But what I have found, particularly working in groups with others, you know, other organizations, other hospitals and things, is as we are creating transformational types of initiatives, what I have seen is that oftentimes people will, you propose something and then people will sort of like undo it, unravel it, take parts of it away until they get it back to a place where they're comfortable. And that's generally a place of inequity. And so it's really hard to, it's a challenge. You know, it's exactly right. It's a challenge to get people to like shift their mindset on this thing. But what you have to do sometimes is draw the line. And in the beginning, I didn't realize what was happening. I couldn't understand why people weren't getting it. You know, why were they pushing against this thing that clearly was a transformation and would take us to a different place? But I realized that it's inequitable, but they don't recognize it as such. And so they're comfortable in this space of inequity, the status quo. And so that's when we really started to do things like, honestly, as recently as this week, Monday, like drawing the line and saying to people, this is what's happening here. You probably don't recognize it, but I want you to realize what is happening here. This is what you're doing. And I know you're well-meaning, you don't mean to do this, but this is not working. And we have to push beyond this. And so, I mean, that's what I would say. And I would just encourage you, please, like not to give up on it and not allow, you know, others to take it back and lose the opportunity to create and capture value in each and every human being you encounter. Because, you know, that's where the transformation lies. And that's where the changes in outcomes and data happen.
Thank you. Ms. Reynolds, I don't know if you had any comments. You look like you wanted to say something.
I do. I just have a few quick points, or 3 points really. One, just congratulations on that focus on silos and breaking those down. That is a huge problem in the industry at every level, and I so appreciate that. My biggest thought on that, which is kind of point number 2, is I think what's really needed in this space is that we become extremely person-centered. Who is the end user? Who is the person struggling in poverty? Because we have silos at the federal level, we have silos at the community level, and we often, coming from a large multi-service organization, we have silos within those organizations. And I think I used to say all the time at Catholic Charities, it is my job to make the accounting team and compliance teams work extremely difficult, not easy. Because what was often so tempting is you got a new funder to give you something, or a government grant, or whatever it may be. And so you started a new program, AKA a new silo for a client to come into. And so instead of it being the headache of accounting and compliance, it shifted to the client. And that shift has to change. Right. And then the last thing I just wanted to note is do remember, even though busting down silos, as you do that, take it the step further. And even with all the well-intentioned organizations you're pulling together, build evidence about, are what they doing really worked. I know when we built evidence at Catholic Charities Fort Worth with the new we at Leo, there was so much I thought, I had a hunch as a social worker was working, and frankly, it really wasn't. And so having that evidence, that causal evidence, really can make a difference. And you should be really proud in your district, because Leo has studies going with the city of Rochester on the Earned Income Tax Credit Program, as well as Action for a Better Community and Catholic Family Support Center, all on intensive case management to move the needle on poverty. So you guys are already off to an amazing start there.
And I will say Catholic Family Center, Action for a Better Community, the city of Rochester, all part of our systems integration work. And you make a really good point, which is people forget what we're trying to do, and trying to get the best practices is tough, because I hate to say this, it pains me. Sometimes poverty is big business for some people, and they're good. We're like good where we are. We're fine. You know, it's good. Just it's the wrong thing, and it doesn't focus on the outcomes that we need to focus on. So anyway, I appreciate everything people have done to contribute to this and to all of your work, and hopefully we'll be able to meet again offline or at a different venue. But thank you, Mr. Chairman. I'll yield back.
Let me, as Dr. Shazabak or Ms. Curry, I don't know if they want to respond to your, are you also, we all set, or?
I didn't want to impose, but I'd love to hear if they have any comment. Obviously,
Yeah, I'll say something. First of all, I think what you're doing and have implemented already is just so incredible. And I just, like, as a mom and an empath in general, just your story of your wife and Dasani is just, it's just heart-wrenching. And it makes me feel like I just wonder if there was something that could be done. You know what I mean? We raise our children and tell them every single day, you know, you're unique, you're special, you're an individual, but then, you know, their healthcare and their nutrition and the plans that are put in place for them just aren't special or unique. They're just very broad, and everybody's kind of thrown into a bucket. And you're right. I think people need to be addressed on an individual level. So I wonder if there was some sort of database with all of these local organizations that you've put together, if there was some database that they could access to see people's charts and their medical history and their mental health history, and have something that is accessible in each community, still on a confidential level, but just so that it could be seen. I wonder if that might help, you know, start change, because I do think about somebody showing up to the hospital and, you know, not wanting to discharge them because you don't know what they're going to do. Right. And it's true. And you don't want to have to ask the questions, because nobody wants to unpack their past again and go through their history and their records.
So I don't want to interrupt you, but that's a great question. One of the things we do, there's going to be a dashboard that brings together your health, educational, social, but the permission will be granted by the individual. So no one will see the information that they're unwilling to give. But that's part of building this ecosystem, the shared data ecosystem and the shared language, so that a hospital worker knows what the healthcare or what the housing specialist is talking about, because we've built this shared language protocol, and we all share the same. There's like several domains, and we've all agreed on the empirical data, which would say this person's in crisis around housing or food or proper age appropriate development from a behavioral health point of view. So that's really important. And yeah, it's one of the things that will make this work is everybody, basically the adults who touch the lives of this child or adult, could be a senior citizen in crisis, that they all have common data points that they're working off of in this dashboard, which, but again, because of privacy issues, it would be activated on someone's smartphone or well, however that individual regulates who has access to their information, their data. But it's a great point.
Yeah, I think that's great. And then it allows, each organization to address the needs, each person's needs as they come through. And they're able to filter through, who needs what. And so I think that's great. So I feel like the model you're building out then is great. And it's just about implementing it into different communities.
Yeah, thank you.
All right. Let me ask unanimous consent to insert in the record a letter from Defeat Malnutrition today, calling for action on the national level to combat older adult food insecurity and malnutrition, which is sadly a growing problem. And I also ask unanimous consent to insert into the record a letter from the National Education Association emphasizing the importance of providing healthy school meals to all students at no charge to them. Let me now yield to the gentleman from California, Mr. DeSagne.
Thank you, Mr. Chairman. Really, thank you for a terrific hearing. Thank you for your passion about this subject matter. I wanted to, and I also want to thank all of the panelists and invite you to the San Francisco Bay Area, to Oakland. I have the pleasure of Aisha. I think you used to be a constituent, I'm told, when you lived in Walnut Creek, California. But my wonderful friend and neighbor, Barbara Lee, who represents Oakland, we've done a lot of things together in the 80 corridor in Richmond, California. And we've really done some good work. And I would encourage you to come out here. Good partnerships with the nonprofits, the Bay Area Partnership amongst them. And in that regard, like Mr. Morelli, when I was in my previous life in the state legislature in California, at the request of the Bay Area Partnership, I headed a task force that was bicameral, where we went around the state of California to look at nutrition issues for kids in particular. So if we're going to deal with hunger, and I appreciate how much time we've spent on this, is that we could focus generationally. And having had another career as a restaurant owner and been engaged many years ago, owning a restaurant in Berkeley with School Gardens and a colleague / competitor, Alice Waters, at Chez Panisse. And I would invite you all to come to the Martin Luther King Middle School in Berkeley, of which the vice president and I have talked about. She, having grown up there, she's very familiar with these programs. But that was about letting kids have the tools. So I remember being on this task force in a disadvantaged community in South Central LA as we went around the state talking to a young person on after school programs that we funded, by the way, in a bipartisan way. Then Governor Schwarzenegger was very supportive of these. But I asked a young man who had been in gangs why he was spending his time in after school programs out in the garden, learning to cook and learning about nutrition, not just food. And he said, when I go home, my mom's a single mom, and I get to teach her how to bake bread from scratch with the ingredients I bring from the school in South Central LA. So that to me is another anecdotal story that really informs us about how we can make generational change. Mr. Chairman, I think to go to your comments and Mr. Morelli's comments and our hearing yesterday with Secretary Buttigieg that you referred to, when I mentioned these silos, and it's like I have to go to therapy when we start talking about it, having been involved. But if we could be focused on the clients with performance standards, and we can look at other public health models. Teen pregnancy, this country did a great job of informing young people, particularly in disadvantaged communities. So we dropped those for the betterment of everybody. So we can take those models, focus on the client, and I think we can really start to move the dial. So to Ms. Curry, we have programs that work, and I'm all for starting new programs. But as we looked at this, look at what the chairman of the Appropriations Committee was able to do just in the child credit and the earned income tax credit. We've got all kinds of research that shows that by doing those together, we already have the infrastructure. We have lots of benefit from that. Similarly, we have infrastructure in this regard. And I know in the Bay Area, and very familiar with these programs. I have a high school in the East Bay, Pittsburgh High School. It's a disadvantaged community. I've been out there multiple times. Every Friday before COVID, every product given to those students came from a farm within 50 miles of that school in an urban area, granted closer to the San Joaquin Valley. These are all farm to fork nutritional foods that give big value, and to see young people in a community like that to respond and have that value generationally, I think is really where we turn the dial in the long term, Mr. Chairman. So maybe any of the panelists just to respond to that, how we can focus on the child and how we can support programs that already work in communities. And I'd love, Ms. Curry, I know your work and your passion. Some of your husband's teammates once teased me at an event when you lived in Walnut Creek that your husband might want to run for Congress. And I said,
My goodness.
I'm more worried about your wife, but I think I would be supportive. So if you could respond to that, your experience informs so much of this, and I would add my experience. And we partnered with multiple superintendents of education, and then for my colleagues, my predecessor who chaired the Education and Labor Committee in the House, George Miller, for 40 years, was so instrumental in this. So we've got a lot of history, is what I'm trying to get at. Let's bring these programs to scale and really show that they can work, but also have performance standards and let the community be active partners with that.
That's exactly what it is. And when we launched Eat, Learn, Play, it was the July right before that pandemic hit, that next January, February. And so we had to be boots on the ground and learn very, very quickly. But what we came to realize was that the infrastructure was there and that there were amazing organizations doing amazing things. And it really was about bringing people together to let people know, hey, so-and-so is providing produce over here. And this organization is, helping to scale jobs over here. How do we bring them together and have this all make sense? And so really, you're right, the infrastructure is there, and it is about that awareness and the amplification of all of the amazing things that are going on so that everybody can help one another out in the community. And that's really what we do with Eat, Learn, Play. And we've seen that the model works, and we have a very scalable model, I think, with a lot of fact and evidence to back it up. So I would love for anybody here on this call today to reach out to the team and I, to my team and I, to hear more about it. But I agree with you. The structure is there. It's just how do we amplify it?
Well, I'm looking forward to getting the chairman to leave Worcester, Massachusetts, which he loves dearly. And I spent 4 years of my life to come out to the Bay Area and see these programs. Mr. Chairman, unless another panelist wants to respond, I just want to thank you again. And lastly, promise, we can save so much suffering, but also save a lot of money. We go upstream and help these kids. Their performance standards throughout their lives, and their kids are going to be significantly improved, whether it's educational retention or their physical and emotional health. Thank you, Mr. Chair. Unless any other panelists wanted to quickly respond, I know we're near the end of the hearing.
All right. Okay. Well, let me, before I yield to Ms. Ross, let me ask unanimous consent to put into the record a statement from the Root Cause Coalition in support of today's hearing. And I'm proud to say that I've worked with this coalition since day one. Barb PT from the executive director has been a friend and important partner in my work to end hunger. Tom Dorney, the director, worked for our late friend, John Lewis. I think of John often, and I'm so grateful for Tom's work. And I'm looking forward to working more with Barb and Tom on this as this project moves forward. And I appreciate their support. And now I would yield to Ms. Ross. And thank you, Ms. Ross. I know you've been very patient, and you've been in and out of other hearings, so we but the floor is yours.
Well, this is an important issue and it's worth all of our time, not just today, but going forward. And I want to thank the chairman and the ranking member for their bipartisan leadership on this issue. For the panelists, and I will not take more of your time. I know what it's like to sit for 3 hours and look straight ahead and be attentive. So I do want to raise an issue after I tell you a little bit about my state. That I'd like to add to the bucket of systemic issues that the chairman hopefully will get a White House conference on. I'm from North Carolina, and North Carolina, more than 13% of households are food insecure, which is higher than the national average. Every night in North Carolina, almost 600,000 households don't have enough to eat. 38% of the households receiving SNAP have children. 1 in 7 North Carolinians struggle with hunger, and 1 in 5 children. And almost 1 million children in North Carolina are at the risk of going to bed hungry every night. And then, of course, we have problems in the school system, but in North Carolina, nearly 60% of the students enrolled in the public school qualify for free and reduced price lunch. And I know that we've touched on a lot of these issues throughout the last couple hours, so I'm not going to ask you to revisit them, but I am asking you to think about this in a different lens. And I'll just tell you a very brief story. I too was a state legislator. I remember going to the neonatal intensive care unit at one of my hospitals, which was known as one of the best neonatal intensive care units for, you know, having premature babies do better and eventually do okay. And I said to the doctor, well, this is wonderful what you're doing, but what could we do to prevent these children from being born premature in the first place? And he said, respect women, respect their mothers. And so I really think that fundamentally, since so many people who are food insecure are women with children or elderly women who don't have retirement income, that one of the ways to remedy this problem is to have economic equality for women. We know that when women earn a fair wage, they're going to invest it in their families first. We know that so many women live longer than men, and they don't have a pension, and they don't have that retirement security, and that is why they are food insecure. So I want to ask you, because we've got 4 pretty diverse women here, if we lift women up financially, and we just passed a pay equity bill on the House floor, will this help with hunger?
Absolutely, without question. Women's economic sort of empowerment has really driven a lot of our growth as a nation. I edited a book a few years ago called The 51%, which was about women's economic activity, and I'm going to send it to you right away. You're absolutely right that women, you know, face a disproportionate amount of hunger, of poverty, of food insecurity at all ages of the distribution. You know, especially those elderly, but then younger women with children. There's a lot that we can do, and you know, I agree with you that certainly issues around building that human capital, that childcare, elder care options, and opportunities for education will really go a long way.
Thank you. Does anybody else have anything to add?
I 100% think that that would help. I watched my mom growing up work 12-hour days, sometimes 15-hour days, 6 days a week, never to have time for herself, and always to take whatever it was that she was bringing in and give it back to us kids. So I 100% think that that would help bridge that gap. And that, I mean, as a mom, like any mom on this call knows that whatever's coming in, it's going straight to the kids. I mean, so I think that that would definitely help if women were respected in that light a little bit more, a lot more.
I too agree, 1000%, actually, because, I think just as the previous 2 speakers just stated, I mean, women are always sacrificing. They're always thinking about their families first, always thinking about their children first. And I would say even in the work world, I'm not so sure that women receive the kind of respect, that they should. There's wage inequality, and in the academic world, like in medicine, you don't see women rise to the ranks of professor and things like that at the rate that men do. It's because they are making sacrifices, making their families first, but they should not have to lose out because they are raising their families. They often get made to start all over again, when they take time out for maternity leave and these types of things. So, but I think women are natural entrepreneurs, to be honest with you. I mean, raising your family is a bit of an entrepreneurial kind of a endeavor, if you really think about it. And so, and also during COVID, on a social level, women were impacted more than others, in terms of the things they had to give up to take care of the family, staying at home, the kids can't go to school, all these various different things. So thank you so much, Ms. Ross, for raising that.
And if I could just say, they all said it beautifully, and I concur. And also a special thank you to Chairman McGovern and Ranking Member Cole for having 4 women testifying today before this hearing.
So, Mr. Chairman, I just want to put that on the table for one of the issues for your conference, which I pray will happen soon. And with that, I yield back.
Well, thank you very much. And before I yield to Mr. Cole for any final comments, I just want to make sure that you all have, if you have briefly, if there's anything that we have missed, let me just say, Ms. Curry, I want to make it a point to come out to California. Hopefully we'll bring others out to see your incredible program. And Dr. James, I want to bring people up to see what's going on at Boston Medical Center. And we'll go to Northwestern and Notre Dame. Those are 2 schools when I applied for college, I couldn't even get into the cafeteria, never mind get accepted to attend those schools. But interesting enough, George McGovern got his PhD at Northwestern. So there's a connection there. But let me just begin. Dr. Schazenbach, why don't I begin with you? Any final words, and then we'll just go around, and then I'll yield to Mr. Cole for any closing remarks.
I just want to thank you for this, for both of you, for convening this hearing. Ending hunger is something that we as Americans can do, and it absolutely should be a bipartisan effort. And so I look forward to continuing to be part of that and working with you all.
Thank you. Ms. Reynolds?
Great. Well, thanks to all of you for having me today at this hearing. Chairman McGovern, you are welcomed anytime to Notre Dame. And I know our university, one of the things I love so much about it is in our mission statement talks about a disciplined sensibility to approaching issues of poverty and injustice and inequity. And so this is an issue we as a university just care so much about. And so to continue to be a part of that in any way, we would love to do. I also just want to note, I think a major to-do coming out of this is for Leo to do a research project on Ms. Curry's amazing project so we can build evidence. So when the point comes to it, all of you as policymakers will scale up what she's doing across the nation. That's it for me.
Thank you. Ms. Curry?
I guess I just want to say thank you for this amazing, productive meeting. It's my first time being in a room like this, and I've learned so much, but realize there's so much work to do. So I really hope that next step of getting everybody in a room and connecting those dots and having a big, giant meeting of the minds to figure out how to really tackle and resolve this issue happens. I really hope it happens. And I feel confident that it will. So just thank you for having me here today to speak on what I've seen in the community.
Thank you. Dr. James?
I too just want to thank everyone and thank you, Chairman McGovern, for inviting me here today and for the privilege to be here with the panelists as well as the other representatives. I am so hopeful because I've listened, I've learned, and there's so much opportunity I see that's in front of us, and I don't think we're starting from square one. I too am trying to imagine, this conference, this White House conference, and what that could do for in the way of transformation. So thank you to everyone. I really, really am grateful for this opportunity.
And now let me yield to the birthday boy, Mr. Cole, for any closing remarks he may have.
Well, thank you very much, Mr. Chairman. I actually will be part of the escort party for the president tonight, so I'll try to put a plug in for your White House conference. I'm
Thank
sure
you.
it'll help a lot. But I do want to thank you very much for the hearing. I want to thank all of our witnesses. They were all spectacular, well chosen. Appreciate your insights. Much more profoundly, just appreciate the work that each of you is about and how you've dedicated your time and your careers and your interest and your energy to things that are truly important in making life better for every American. And who knows, Mr. Chairman, we get that conference. You may not have been able to get into Northwestern and Notre Dame, but I bet you could snag an honorary degree. Thanks again, and thank you particularly, Mr. Chairman. It's a good hearing. It's an important topic, and thank you for your passion. More importantly, thanks for not being a flash in the pan on this issue, but somebody who's literally spent a career working and advancing these causes. It's something that we're all proud of on this committee in a bipartisan sense. Your leadership here is much appreciated. I think will make a meaningful difference in the years ahead. You'll back.
Well, first of all, I thank the gentleman for his kind words, but also for his, and all the members of the committee for, and the witnesses too. This has been over 3 hours, and so I appreciate you being part of this. As I mentioned in my opening, ending hunger has been a focus of much of my time in Congress, and I think, and I really want us to step it up and go to the next level here, where we actually think out of the box. We reimagine how we combat hunger, and we do something meaningful about it that actually ends hunger in this country. This hearing, I think, is an important first step, and there'll be a lot more hearings and briefings and site visits. But this is a first step. But I'd like to leave with just a couple of points. First of all, we have a hunger problem in this country. There's not a congressional district in America that's hunger-free. And as I said at the beginning, I'm ashamed of that fact. We all should be ashamed of that in a country with all of our riches. And if you've ever met a hungry child, and I've unfortunately met way too many in my lifetime, it breaks your heart. It's just because it doesn't have to be. People are hungry who are young, people are hungry who are old, everything in between. The Mazon, which is a Jewish response to hunger, reminds us that there are many members in the military who are defending our country, who are hungry as well. But the thing is that hunger is real, but it's also a solvable problem. And that's what makes it so frustrating. It's not like that there's no way to solve it. There is. We just have to choose to solve this problem together and make it a political priority. Second, the people who are hungry, who are dealing with hunger, deserve respect. They deserve dignity. And that starts by listening to them and not talking at them. We've all been meeting leading up to this, and we will have hearings with people who are who are dealing with the challenge of hunger right now, who have lived experiences. The bottom line is, these people are not caricatures, right? I mean, they are individuals. They are neighbors. They are our friends. Some of them are our family members. And between work, school, volunteering, and taking care of loved ones, they have a schedule that will make any one of us on this panel, in this dais, blush. Being poor is hard work. Struggling with hunger is hard work. And these people, they do it while trying to figure out, where their next meal is going to come from, and how they're going to put food on the table for their families. And I know that developing this roadmap to end hunger sounds hard. And as we talked here today, there's all these different things that we need to consider and aspects that need to be put on the table. But you know what? What's harder than solving this is being hungry. And so not knowing how you'll feed your kids, having to choose between food and medicine, That's hard, and we can end hunger in this country. So please join me in this effort. You're the first panelist in our effort here. We hope we hope that we can rely on you for additional information along the way. If you have ideas, please get in touch with us. Hopefully, we'll visit some of the programs that we're talking about here on site. Follow our work in the Rules Committee. And to those who are listening, give us information. Go to our webpage. Because it's going to take an all hands on deck approach to end this end hunger. Again, we are doing this with the intention of trying to persuade the Biden administration to do a conference. The last conference on this issue was 52 years ago. And actually the president at the time was Nixon. And my last name being McGovern, I'm actually saying something nice about Nixon. I can't believe it. But in any event, as imperfect as that conference was, it produced a lot of results. The final thing I'm going to say is that, and I think everybody here made this point, when we talk about ending hunger, we're also talking about promoting nutrition. Ending hunger is not just about filling somebody's stomach up with whatever. It's also about making sure that we are promoting nutrition. And so that's another key factor here. So I, again, am grateful to everybody. Thank you so much. And with that, the hearing is adjourned.